Great. Thank you, Madam Moderator. So it now is 10:02, so I think we can go ahead and get started. I'd like to call today's meeting, August 27th, 2021, to order. And if Madam Secretary Linden, if you could take roll call so that we can establish quorum.
Sure. Okay, Dr. Wing,
Oh, present.
Mr. Mordomi,
Present.
Ms. Brandvine,
Present.
Dr. Garcia,
Present.
Dr. Kawaguchi,
Here.
Ms. Linden here, Dr. Pruitt,
Here.
Ms. Sims is absent, I believe, and Dr. Turetsky.
I am here.
Great.
Thank you. So it looks like we have quorum. And before we get started, I just want to say good morning to everyone. And I just wanted to give everybody a timeline of how this meeting is going to go. Shara, correct me if I am wrong on this. In addition to the updates and reports that we're going to be hearing today, we have two presentations from ARBO and from our enforcement team. And taking these into consideration, our timeline for lunch, we're looking at probably starting around 1 or 1:15. And we have a hard start again at 2 p.m. for a closed session. Okay, so going.
That is correct. Oh, I'm so sorry.
Oh, go ahead.
President Wong, that is correct. We also have a presentation from our licensing staff as well.
That's right, yes. So 3 presentations. Thank you. All right, so on that note, let's go ahead and go on to item number 2, which is public comment for items not on the agenda. Madam Moderator, if you could open up the chat.
Thank you, Madam President. I've opened up the question and answer panel. If any member of the public would like to make a comment, please type comment or I'd like to make a comment using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions for your reference. There will be a 2-minute time limit. I'll give you a 10-second warning. And just be aware that while you're free to express criticism or negative views for the sake of members of the public participating on the call, please do not use profane language when making public comments. And we will give you a moment. And all right, we have okay, so we have a question, but it's not for this agenda item. But the answer to the question is yes. They're just asking about someone making a presentation.
Oh, okay.
All right.
So-
I do see one raised hand, so let me. Okay, the hand's lowered. So at this time, I don't see any requests for public comments. Madam President, would you like me to close the Q&A?
Yes, please.
Okay.
Dr. Wong, if I may, I just want to make sure we did have a licensee on who I know we've been working with at the board as well as at the legislative level. I want to make sure that we give him the opportunity to get into the right queue in order to comment. He certainly was going to be commenting on an item not on the agenda and emphasize that before the meeting began.
Okay.
So if there's an opportunity for.
So should we keep public comment open, or if he logs on, could we come back to public comment again?
Major Kim, are you still with us? If you are still with us, please enter that you would like to speak into the chat. Or I'm sorry, moderator, is that still open?
Hold on, and let me get that open. Okay. So the question and answer feature is now available. If you wish to comment on an item that is not on the agenda, now is the time to do it. So please go ahead and type that you would like to make a comment using the field in the lower right-hand corner of your screen. If you're not seeing that field, go ahead and click on the question mark within a square.
No, I apologize. So there's another, this is an issue specific to service personnel within the military. And so Dr. Major spoke to us earlier today before the start of the meeting. And so I want to make sure that Dr. Major understands that this is when he would make comment on items not on the agenda and would just need to type that he would like to make a comment into the question and answer box.
And this is a moderator. I do see him as an attendee. I can give him permission to unmute himself.
That would be probably a good idea.
Okay. So Dr. Major, I am giving you permission to unmute yourself. Okay, you're unmuted.
Thank you.
Mhm.
Oh, I couldn't find the box. First of all, thank you, board, for all the work that you do. I'm the guy that you don't hear very much from. I just send my check every other year, but I know all the work that you do. I'd like to just quickly give you an update on an issue that I've been working with a loose coalition of people, and that has to do with the children's vision care issue in the state of California. You're probably aware that now the Department of Healthcare Services is responsible for almost over half the children in the state of California with affordable health care, and almost 87% of children of color. This last year, the PIA problem with giving glasses affected over 100,000 children. They had to wait months and months to get their glasses. It highlights what's happened to our state. Gradually, again, the state is in the business of taking care of children's vision. At this time, I'm just so surprised as it become from me a local issue to a statewide issue, how little representation these children have in the state. Department of Healthcare Services, they have 2 people doing vision care now. I've probably contacted them 20 times. There's no one there. So I have 2,000 individuals in the $128 billion program. Children's vision care is not represented at all, I think. The key thing is that I've been involved with quality assurance with corrections and other things. I was hoping the board would support the idea that we need to have children's care on the healthcare dashboard. All managed care now really is run by data and healthcare dashboard. And there's no children's representation. We have lots of other things, but it's just phenomenal to me. The Department of Healthcare Services with over 2,000 employees, 2 on vision. Just give you one other statistic. Recently, as the state has taken over the PIA for the whole state, San Mateo County, considered the richest per payroll county in the United States. Last year,
10
we have the numbers
seconds.
now. Okay, only 600 glasses were given that whole county. And so we have lots of children not being cared. So I'm hoping that someone on the board have an interest in let's making sure this is on the dashboards. The state starts getting the data and serving our children. Thank you.
All right, this is a moderator, and we have no further requests for public comment. Madam President, would you like me to close the Q&A?
Yes, please. Thank you.
You're welcome.
And Shara, can we put children's vision discussion back on the agenda for a future meeting? That's been a topic that we have discussed over and over again in the past. So definitely bring it back up.
Yeah.
Great, thank you.
And we as staff, I just want to say as well that in the interim, though, Dr. Major, and I apologize for misrepresenting what I thought you were going to speak about, but please go ahead and give us a call at the office or email me directly. Would love to be able to chat with you because it sounds like you've got some direct action that we could take, and staff can do some research before we put that back on the agenda for the board.
Great, thank you. All right, so now that we are done with item number 2, let's go on to item number 3, the president's report. So today, I just wanted to thank all of our board members for not only serving on the board, but also agreeing to serve on committees. So here's a list of our current committees and work groups. So thank you everybody for your service, for agreeing to serve on our committees. In addition, I would like to make 2 suggestions. In the past, our most recent past president, Mr. Moridomi, he had appointed one of our past professional members, Dr. Madhu Chawla, to our Practice and Education Committee, and her knowledge and expertise was actually very helpful in our committee. I would like to make the suggestion that Dr. Chawla be reappointed for another year to the PEC. The reason why is that both our current PEC consists of Drs. Pruitt and Garcia, both of whom are relatively new to the board. Dr. McIntyre and I were the other two members of the PEC. Dr. McIntyre is no longer with us, and I've taken myself off of all committees. So I think it would be helpful to Drs. Garcia and Pruitt to have Dr. Chawla with them this next year. And then also another suggestion, I would like to appoint Drs. Chawla and McIntyre to our telemedicine work group. And the reason for that is they were the two members of our previous telemedicine work group. And if possible, I would it would be helpful to our current work group, who are both new members to the work group, to have Drs. Chawla and McIntyre on the telemedicine work group. So if someone would like to make that, if you guys agree with me, if someone could make that motion, I would appreciate it.
I'm happy to make the motion, but do we need public comment first?
Oh, yes. Thank you, Doctor. Thank you.
No,
Thank you, Ms. Brand.
no, pardon me. So if there's a more motion on the floor, that would be a good time to call for public comment
Okay.
before the vote.
I'll move to approve the president's proposed appointment of Dr. Chawla and Dr. McIntyre to the telemedicine work group pursuant to the board policy regarding committee appointments as listed in the 2019 edition of the Optometry Board Member Handbook.
Sid, I think you forgot to include Dr. Chawla as a member of the Practice and Education Committee too.
Apologies. Let me restate the motion. I move to approve the president's proposed appointment of Dr. Madhu Chawla to the Practice and Education Committee and the proposed appointments of Dr. Chawla and Dr. McIntyre to the telemedicine work group pursuant to the board policy regarding committee appointments as listed in the 2019 edition of the Optometry Board Member Handbook.
I'll second.
Okay.
Now we should open for public comment.
Thank you, Madam President. I will go ahead and open up the Q&A panel. If any member of the public would like to make a comment, please type "I would like to make a comment" using the field in the lower right-hand corner of the screen and submit it to all panelists. We are displaying instructions for your reference, and we'll give you a moment. All right, this is the moderator. I see no requests for public comment at this time. Madam President, shall I close the Q&A?
Yes, please.
Okay, it's closed.
Let's go on to item number 4, discussion and possible approval of our July 9th, 2020.
Pardon me.
Oh,
Pardon me. Now that you've asked for public comment, you might want to call for the vote, for the board's vote on that motion.
I'm just jumping the gun today, aren't I?
You're really efficient, though. That's great.
Let's go ahead and take a vote. Ms. Linden, could you?
Dr. Wang,
Yes.
Mr. Moridomi,
Yes.
Ms. Brandvine,
Aye.
Dr. Garcia,
I vote aye.
Dr. Kawaguchi,
Aye.
Ms. Linden, aye. Dr. Pruitt,
Aye.
Ms. Sims is absent, and Dr. Turetsky.
Aye.
Great.
Great, thank you. So it looks like motion passes. Rebecca, am I missing anything else before we go on to item number 4?
All set, I think. Thanks.
All right, great. Thank you. All right, so now let's go ahead and talk about item number 4, our minutes, discussion and approval of the July 9th, 2021 board meeting minutes. Does anyone have any comments about the minutes?
This is Glenn. I do have a correction. Under number 6, future agenda items, my recommendation was inviting the NOA. Although I wouldn't disagree with what was written, about inviting Arvo. But my specific recommendation in future agenda items was to invite the NOA.
Okay. So if staff could make that adjustment, that would be great.
Of course.
What you might want to do is if you're, if the board goes forward in adopting these, in approving these minutes, you might want to include that in the motion, just with that one change, or if there are others, I move that we approve the minutes, that kind of a motion.
Okay. So are there any other comments? No. So can I get a motion to approve our July 9th, 2021 board meeting minutes with the correction of that Dr. Kawaguchi just stated, changing his future agenda items from ARBO, an invitation to ARBO, instead changing it to an invitation to, what was it again? NOA.
This is
I'll
Dr.
move-
Garcia.
Okay.
I move to accept the minutes as amended.
I'll second Mark Mordomi.
Ms. Linden, if you could take a
Okay, so we're voting to approve the motion.
Pardon
Just a
me,
moment,
I know it's
apologize.
tedious, but before the vote, we might want to take public comment. Are we?
Thank you. Again, Madam Moderator, if you could open up the public comment.
Thank you, Madam President. I've opened up the Q&A panel. If any member of the public would like to comment on this agenda item, please type comment, or I would like to make a comment using the field in the lower right-hand corner of the screen and send it to all panelists. We are displaying instructions. If you do not see the Q&A panel, look at the bottom right corner of your screen and click on the question mark within a box. We'll give you a moment. All right, Madam President, I see no request for comment at this time. Shall I close the Q&A?
Yes, please.
Okay, it's closed.
Great, thank you. And now, Ms. Linden, if you could take us through our vote.
Great. So we will vote to approve the motion to approve the July 9th meeting minutes with Dr. Kawaguchi's amendment. Dr. Wang?
Yeah, aye.
Mr. Mordomi?
Aye.
Ms. Brandwein?
Aye.
Dr. Garcia?
Aye.
Dr. Kawaguchi?
Aye.
Ms. Linden? Aye. Dr. Pruitt?
Aye.
Ms. Sims is absent. And Dr. Turetsky?
Aye.
Great.
Excellent. So again, it looks like motion passes. And let us go on to item number 5, which is the presentation by Arbo.
And this is the moderator. I'm just going to promote the speakers. All right, they've been promoted and can unmute themselves freely.
Hi, can you hear me? This is Lisa Fennell.
Yes.
I want to thank you all for inviting me to come to this meeting and give a bit of an overview of Arbo's annual meeting that took place in June. We were hoping that we were going to be able to come to Southern California for that meeting, but unfortunately we weren't able to. So the meeting ended up being virtual again, as you know. So joining me today is one of Arbo's newest board members, Dr. Ken Lewenda, who I see on the slide is also a former member of the California State Board of Optometry. So I'm just going to give you a short overview of the meeting, and stop me at any time with questions. We had just some general business conducted, approval of our auditor's report, approval of our 2022 budget. In addition to Dr. Lewenda, we had a second new board member elected, Dr. Rebecca Sparks Doherty from Kansas. So we're happy to have these two new board members. We had 4 resolutions approved at the meeting, and I believe that you all have gotten copies of those. So you can certainly let me know if you have any questions about anything. We had some presentations and discussion of changes that have taken place during the pandemic by the member boards of ARBO, and some discussion about what you might want to continue going forward. Some of those topics were telemedicine, licensure exams, board operations, provisional licensure, and safe infectious disease practices for optometrists. We also had a report by our OE Tracker Committee where they talked about the different ways that OE Tracker assisted our member boards during the pandemic. They also talked about the importance of doing CE audits and the different ways that OE Tracker can help, from providing CE data reports to automatically transferring data, to work with an electronic licensing program that your board may have, to having ARBO do the CE audits. We've started doing audits for a couple of different jurisdictions and actually have a couple more that are going to be coming on board. So there are just a lot of different ways that state and provincial boards can use OE Tracker. I'll pause for a minute if anybody has any questions about anything I've said so far.
Can I just ask how many states you're currently doing the CE audits for? And is it 100% then with each state as well?
Yes. When we do the audit for them, it's 100%. We have 3 that we're doing it for now, and we've given proposals to 2 or 3 others who are considering it. We have several, probably 6 or 7 at this point, that just have the automatic data interchange, where when they're, it works with their electronic license renewal process. So when an optometrist applies to renew, their system comes and basically talks to ours and pulls the data. And then if that optometrist is found to meet the requirements, they're allowed to renew. So we have quite a few that do that too.
Great, thank you.
I have 2 questions. This is Mark Mordomi. I can wait or I can ask them now. I'll ask them now.
Now, I guess.
I'd like to hear a little bit more about the provisional licenses. Those were a subject of very great discussion here in California. What states have provisional licenses, and how did it go? That's question number 1. Question number 2 is, what areas do other states see as growing areas of enforcement activity?
As far as provisional licensure, we had the North Carolina Board of Optometry and the Alabama Board of Optometry speak at our meeting. I don't believe there's any other state that has a method for provisional licensure outside of COVID emergency rules, that type of thing. So North Carolina and Alabama both have additional exams that the licensees must take in order to be licensed beyond the NBEO parts 1, 2, and 3. And so they do allow, in case there's a lag, and these have been in place for many, many years, in case there's a time between when the optometrist graduates from optometry school and can get to take these state exams. Sometimes there's a few months time. They allow them to have a provisional license. In North Carolina, they have to practice underneath a supervising optometrist. In Alabama, they don't, but the license is only good for, I believe, 90 days, and then it expires, and they're expected to take the state exam during that time.
Ms. Fennell, did states enact provisional licenses, other states enact provisional licensing provisions because of the pandemic outside of those 2 states?
There were a couple, I believe, that allowed sort of like a waiver until the pandemic was over. So they were allowed to, they issued a license, but I don't have a lot of details on those. I just am very familiar with North Carolina and Alabama because they spoke at our meeting. But I think there were a couple that might have enacted something due to the pandemic, which will be Some cases those are expiring in September. Some states they're through the end of the year. It just depends.
Yeah, if you could provide that information to our staff, that'd be very interesting. If you hear of it.
Sorry, your second question, I forgot what you asked.
That's all right. What are the growing areas of enforcement activity by the boards in other states?
I'm not sure I really have that information, and that it's not something that we talk about regularly. We do have um, regional meetings sometimes with boards where we would get into that type of information, and we have quarterly meetings of the executive directors of the boards where that type of information comes up, but it's not something that I regularly, unless somebody approaches me to tell me about it, I don't have a lot of information that I could provide without doing like a survey of our
Sure,
members.
sure.
which
I was
will
just wondering if it was discussed at the meeting. That's all right. Thank you.
No, not really.
Thank you.
Okay, you're welcome. And one more thing about OE Tracker, we are looking for volunteers for our OE Tracker committee. This year, we made some substantial changes with the launch of our new website and our new mobile app. But we're always looking for new ideas and new perspectives on ways that we can improve the experience for our member boards and also for optometrists. So if anybody, be happy to have you. Okay, so moving on, we talked about the COPE committee talked about revising the COPE categories. That's going to take effect in January. I think you all have a copy of the new categories. The definitions have been updated and some of the categories are being combined. The perioperative management of ophthalmic surgery and refractive surgery management categories are going to be combined into one. The treatment and management of ocular disease, anterior segment and posterior segment are going to be combined into one category. And oral pharmaceuticals and pharmacology are going to be combined into one category. We're also eliminating the principles of diagnosis category because it was not used very often. And we have incorporated courses on diversity, equity, and inclusion into our public health category, which we've actually, even though the category formally isn't changing until January, we started doing that earlier this year because we saw a need for it, that they just didn't fit in any previous COPE category. So that change has been made. The COPE committee also described COPE's accreditation system, how it's different from course approval due to the standards and accreditation criteria that COPE follows. And COPE continues to be a member of the Joint Accreditation of Continuing Education in the Health Professions Collaborative, which allows optometrists to be recognized as a member of the healthcare team and to join other healthcare professions and interprofessional continuing education activities. So that's exciting. And I'm also happy to share that COPE's accreditation program was reaffirmed in July to be substantially equivalent with medicine's CME accreditation program. So optometric continuing education sometimes comes up when states are looking to expand their scope, and now it's it's a good thing that you can report that the optometric continuing education that is accredited by COPE is equivalent to the continuing medical education given to physicians. Any questions about COPE?
So Dr. Garcia, I have a question, Ms. Fennell. When you created the new categories for COPE, did you have a category specific for recognizing elder abuse or child abuse? Just curious.
No, we usually put that in our public health.
Okay. Do you have a classification for practice management?
Do, yes.
Okay. Thank you.
Welcome.
I have a question. This is Mark Mordomi.
Mhm.
You mentioned this in your talk about COPE and diversity, equity, inclusion CE. Can you repeat what you said, and perhaps it's a question for you, or maybe a question for the members of our practice education committee or staff. How does the inclusion of those classes at COPE integrate with what we are doing with our CE requirements here in California?
I'm not sure I can answer the question. I'm not really sure what you're doing with your requirements.
Sure. So tell us again what COPE did with diversity, equity, and inclusion. Because
Yes, we
I heard
started,
yes.
due to all the changes in the past year and things that have happened, we did start getting people submitting courses where they wanted to talk about diversity, equity, or inclusion issues. Um, and we found when we would look at our categories that they didn't fit anywhere. And it's not that it wasn't good or valuable education, they just didn't fit anywhere. So COPE looked at the categories and decided that it would be good to include those into our public health category. So we revised that as part of this ongoing category revision, but decided to change that one this year since we were, like I said, starting to receive courses, even though the other category changes won't take effect until January.
Okay, thank you. And so, staff, am I correct that COPE classes are counted toward our continuing education requirements? Is that right?
That
Um,
is correct.
Okay. All right. Thank you.
Okay, we also had our National Board Exam Review Committee. They reported the findings from their 2020 review of the NBEO exam development and administration process. So you should have a copy of that report. And I'd like to thank Dr. Wang for participating on the committee last year, and Dr. Pruitt has volunteered to participate this year. So that's great. We always love to have you as volunteers. So the NBERT committee evaluated the content of the exams. They discussed the ongoing development by NBEO of their Part 3 exam, which is now called PEPS, P-E-P-S, the Patient Encounters and Performance Skills Exam. And issues related to the pandemic are all addressed in the report. And they also went over the findings of the task force that was established in 2020 by ARBO and NBEO to look at alternative testing methodologies during the pandemic. So the task force report was also included. I think you've probably gotten it several times. Is there anybody has any questions about this? Okay. We were also joined by the president and president-elect of the National Optometric Association. I know you all were talking about them a little while ago. They came to our meeting for the first time to talk about the NOA, what they do, their activities, and some of the issues related to diversity, equity, and inclusion in optometry. So over the past year, ARBO has developed a closer relationship with the NOA, and they really helped educate us on some of the challenges faced by people of color in optometry, things that we just weren't aware of. So we have decided to add a board liaison to the NOA this year for the first time so that we can continue to expand on that relationship. They really have a lot of good information to share. So I think if you do invite them to one of your meetings, you'll be very impressed. Any questions about that? Okay. Lastly, we had members from the Mississippi and Wyoming boards of optometry who discussed the recent scope of practice expansion in those states. And they just made some recommendations based on their experiences as to what boards should consider when writing or revising regulations to address scope changes. So, one big thing that Arbo likes to do is create that, atmosphere where all of our members can share what they do, how they do it, challenges, issues they've faced to really help each other when somebody else has the same thing come up. So that is my quick recap of our annual meeting. There any other questions or anything you'd like to know more about? I'd be happy to answer.
Member Brandvine is here. I have a question for you, Ms. Fennell. Does Arbo conduct a survey to gather member input on a regular basis or special cadence?
It's pretty much when requested by another member. They'll say, what do the other states or what do the other regulatory boards do regarding this issue? And then we'll go out and do the survey and compile the responses and send them out to everybody. I wouldn't say a regular basis, just as needed.
To follow up on that, if we wanted to gather input relative to the points that Member Morodomi raised, such as provisional licensing during the pandemic or the like, would our staff be able to work with you to help put together a survey to gather some information for us?
Oh, of course, of course.
If I may.
Sharon knows she can always come to me.
Yeah, definitely. And if I may also, I should probably better cite my sources, right? So when we did have our conversations about provisional licenses last year, we were using the data that was collected from individual member states that was compiled by Lisa and sent to us. So we have certainly come to them, and I apologize, we really, I'm realizing as we're talking through this one, that I think there probably should be a more concerted effort for staff to collect from board members their concerns and queries, and then also to report more often on the interaction that staff has with Arbo on a regular basis. I feel like and not because it's a bad thing, because I love to touch base with my colleagues across the nation. I feel like it's every month, but it's probably quarterly. Lisa, remind me how often we do the executive officer roundtables.
We're doing them every month. We stopped during the summer and we decided going forward to go to quarterly. So we'll be starting back up next month.
So I will make a commitment, Member Brandvine, that after those meetings, I will include in my reports to the board a summary of the discussion that occurs at that level. Again, I should cite my source better because I often do refer to the discussions that we have and the information that Lisa brings to us. But I think if we formalize that, then it also helps the board to better understand the benefit of Arbo and how staff really does interact with the other national boards and how we use that information. Cite your sources.
This is Dr. Wong. Thank you so much for your report today, Ms. Fennell. And I just want to say that Dr. Kawaguchi and we were both able to attend the virtual Arbo, and I know I found it very informative and sad that it wasn't in person, but I was glad that we could at least attend virtually.
Right. Yeah, as you said, it was sad. We didn't want to do it, but it just, safety has to come first. So
I believe everyone had a picture of beaches or palm trees in the background. That's as close as anyone got to SoCal this year.
yeah, I actually got a picture of Newport Beach where we were supposed to be.
I also would like to chime in and thank everybody on the board. Of course, a lot of new board members and a lot of people that I served with, and it was a pleasure serving for 8 years, 2 terms on the state board. It was a lot of good friendships, but a lot of positive things happen. And I want you to know that we on the board, speaking for myself, I'm always available to have anybody on the board reach out to staff or to me directly, and we'll pass the information on. I'd like to also chime in again with what Lisa had mentioned. OE Tracker Committee is an extremely important committee, and one that I really think is important to have somebody from California on our board, or your board, I should say, to really join us, because it'll be important for you to be able to see the benefits, especially if you look at the sunset review and regarding CE and all the things with regards to how difficult it is to do audits. And I think that there's a lot of benefits to the California State Board and to the public at large. So we encourage, and I hope that somebody will raise their hand and say, we want to be able to be on the OE Tracker Committee. So again, thank you for the opportunity to be here. And I can't wait for the time for me to be attending in person to one of your meetings.
Dr. Luenda, we're so happy to have you on the board. And I would just add, as far as OE Tracker or any of our committees, any changes that ARBO makes to our programs, they come from our membership. They come from our committees where the information comes. It would be great if you could do this. We need that. So that's why we're always looking for ideas, feedback, ways that we can improve and make things better, because our goal is to provide you with tools to help you do your job better. So we definitely encourage you to participate.
Great. Thank you so much, both of you, for coming to our meeting today.
Thank you.
Does anyone have any other questions for Dr. Luenda or Ms. Fennell? If not, then I guess we will be going on to item number 6, which is our update from the Department of Consumer Affairs.
Good morning, Board President Wong. Are you able to hear me?
Yes, we can hear you now.
Good morning, Board President Wong and board members. I am Carrie Holmes, Deputy Director of Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me to provide a department update. I'd like to take the opportunity to congratulate Board President Wong on your election as President, along with Mr. Morodomi as Vice President and Ms. Linden as Secretary. I'd also like to officially welcome Dr. Pruitt as the newest member of the board. Thank you all for your service and leadership. DCA is receiving many questions about whether boards and committees will be able to continue to meet remotely. As the law and executive order stand today, after September 30th, all boards will be required to return to in-person meetings with publicly noticed meeting locations. However, due to ongoing changes in the COVID-19 pandemic, it is possible that the ability to meet remotely will be extended in some capacity. I don't have any concrete news on that today, but DCA will do all it can to assist boards to plan safely for in-person meetings and keep you informed of any additional changes to meeting requirements. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination or will be subject to regular COVID-19 testing and required to wear appropriate PPE. Board members must follow these health and safety protocols as well if they plan to be physically present in a DCA location, whether for a board meeting or just a quick visit. Members must verify vaccination
Did we lose Ms. Holmes?
She appears to be muted. We've all been there, Carrie.
Yes, most certainly. Sometimes those underage colleagues just don't understand the schedule for the day.
I'm so sorry, having a little challenge this morning.
That's life. This is great.
Let me resume here. So to further protect Californians and healthcare workers, the California Department of Public Health recently issued public health orders requiring workers in healthcare settings to be fully vaccinated and also by testing visitors when visiting certain healthcare facilities. Licensees are encouraged to thoroughly read the CDPH public health orders and regularly check their local public health department website for additional vaccination requirements. We know things are moving quickly and there's a lot of information, both official and unofficial. I encourage all members and the public to visit DCA's COVID-19 webpage for updates and resources on the state's reopening, public health guidance, vaccinator resources, and more. As a reminder, 2021 is a mandatory sexual harassment prevention training year, so all employees and board members are required to complete the training, which can be accessed through the learning management system. As always, Board and Bureau Relations is here to help. If there's anything we can do to assist, please reach out. This concludes my presentation, and I will hand it back over to Board President Wong. Thank you so much for your patience.
Great. Thank you very much, Ms. Holmes. Does anyone have any questions for Ms. Holmes? Nope. So if there are no questions, Shara, if we can have the budget office give us an update.
Oh, certainly, and we should have Bikram Dhaliwal promoted as panelist to begin that presentation.
Hi, everyone. Can everyone hear me?
Yes.
All right. Well, good morning and happy Friday, President Wang and members of the board. My name is Bikram Dhaliwal. I'm the budget analyst from DCA Budget Office, and I'm here today to present on the status of the board's fund and just give a general budget update. I believe everyone should already have copies of the agenda item 6, which includes the board's fund condition statement as well as expenditure projections. So if I'll go ahead and quickly outline those, and I'll address any questions that any of the board members have. And I think on the agenda item, the fund condition statement is first, but if you don't mind, I'm actually going to start with the expenditure projections, which is on page 3. So if anyone wants to follow along, I'll be on page 3 of the agenda item 6. So over here we have the board's expenditure projections, and these are fiscal month 12 projections, which for those of you who are not aware, that means that they're through June 2021. So the fiscal year is from July through June. And now that we're already done with fiscal year 2020-21, we have the latest data, which is FM12 or fiscal month 12. And we're still working on closing out the fiscal year, which we call FM13. And but the thing is, FM12 is the most recent we have right now, and we believe these numbers are very close to what the actuals will be. We're just letting our accounting office process any other expenditures that might come through as the fiscal year is being closed over the next month or so. So as you can see at the bottom right of these expenditure projections, the board is projected to revert about 18.6% of its budget, which is ultimately good news in the sense that those are considered savings. So right above that 18.6% at the bottom right where it says surplus, right above that, there's a number that says 408,949. That's actually the dollar amount that we're projecting the board will revert or save out of the total budget appropriation. And a lot of those savings are coming from various categories, various line items, such as Attorney General, personnel services, and a reduction in travel due to the COVID pandemic, especially over the previous fiscal year. So with those types of things considered, the board is looking healthy in terms of the reversion that we're projecting it to have once the fiscal year is ultimately closed, somewhere in that 18-19% reversion, which is only going to help the board's fund because as I get into the fund condition, we'll see how less expenditures leaves a greater fund balance at the end of the fiscal year, and that's going to help with the reserves that are left in the fund condition or in the fund. So that about does it for the expenditure projections. I know I kind of just quickly went over those, but if anyone has questions, I would be more than happy to address them now. And if not, then I'll move on to the fund condition, which is on pages 1 and 2.
Doesn't look like anyone has any questions. Can we go on to the next section?
All right, sounds good. So I'll go ahead and cover the fund condition now, which is on pages 1 and 2 of the agenda item 6. And as I've mentioned in previous board meetings, 1920, that column shows actuals for both revenue and expenditures. So that's nothing has changed there. However, for current year 2020-21, I've plugged in the current year FM12 projections for both revenue and expenditures. So I know I just covered expenditures on the expenditure projections in the previous attachment, but on the revenue side of things, the board is actually is projected to collect about 1,819,000 with renewal fees leading the way. As we all know, renewal fees are the main driver of most DCA board and bureau revenues. So as this projection shows, about 1.6 million of the revenue for current year is coming from renewal fees, which is an increase from the previous fiscal year and is only projected to go up in future years, especially with the merger with the RDO program. So with those two funds merging and fiscal year 21-22 onward, the revenues are going to get combined as well as the expenditures. But as long as the revenues are slightly ticking upward, I think it'll take care of any expenditures that might potentially increase with the two programs having their appropriations combined. So that about does it for revenue, with renewal fees driving the way, like I mentioned. There are some other categories there, like license and application fees that play a role, but as we can all see, it's mostly the renewal fees. So other than that, I'm going to go ahead and scroll down to page 2 now, which has the expenditures broken out by fiscal year. And just like I mentioned with revenue, for expenditures for the current year 2020-21, I plugged in the expenditure projections from the previous document, which is 1,784,000. And with all that considered, like I mentioned, it's about a $400,000 reversion. So that's ultimately helping the fund when you consider revenue being collected as anticipated, and in some cases even greater than anticipated, and expenditures being less than what was originally budgeted. Those two things combined have an overall net benefit to the fund balance, which we see comes out to about 1,927,000 at the end of fiscal year 2020-21. And although these are not actuals, like I mentioned, these are technically FM12, fiscal month 12, they will be very close to we believe these will be very close to actuals. There might be some small changes as accounting closes out the fiscal year, but overall, these are very close to what they will be. And that leaves us with a 7.8 months in reserve, which takes the fund balance and divides it by the budgeted expenditures for the next fiscal year. So that's just a metric to kind of gauge how the fund is doing. And as you can see, if we actually scroll back up to the first page, on the top left corner, it says 2021 Budget Act with current year FM12 projections. So we have the budget year 21-22, that those figures for both revenue and expenditures tie to what we see on the Budget Act on Department of Finance's website. So I went ahead and updated those numbers, and we see the merger with RDO's remaining fund balance, or at this point it's projected coming in and merging into Optometry's fund balance in budget year +1, which is fiscal year 2022-23. So that ultimately brings in about $1.2 million from RDO, which if we scroll back down to the second page on the bottom right, we see the fund balance shoot back up to over 2 million, specifically 2,574,000, which then puts the months in reserve back at 9.6. So with that RDO fund balance, the remaining amount after the merger coming into and merging into Optometry's fund in 22-23 is definitely going to help the overall fund balance, especially if the board is planning on seeking any resources through the annual budget process. So that about does it for the fund condition. And like I said, everything looks pretty healthy. The expenditures are projected to be significantly less than what was budgeted, and revenue is materializing right around what was expected. So I ultimately don't have anything negative to say. It's positive news across the board. So that about concludes my presentation, but if any board members have questions right now, I would be more than happy to address them.
I have a question.
Yes.
This is Mark Mordomi. So how does the passage of the overall state budget affect us, if at all? And then second question regarding the reversion, the surplus is good news, but is there a concern, or do we have to worry about kind of the use it or lose it syndrome in with government budgets? I know the surplus is because we haven't been able to fill certain positions, and so we'd like to be able to fill those positions in the future. So those are my two questions.
Absolutely. And those are two really good questions. And the use it or lose it is sort of tied to the overall budget question that you asked in the first question. And so for the second, I'll just start with the second one actually first. And it's the savings are basically displaying that 2,193,000 was budgeted for the board. However, only about 1,784,000 or so is actually going to be spent, which leaves us with about 409,000 or approximately. So that amount actually just goes back into the fund. And when we build any ongoing budget, like right now we are in the annual budget building process for fiscal year 22-23, the budget for 21-22 has already been set in stone, I guess you could say, through the Budget Act. Like going back to your first question, that's already been decided. The way we build the budget, it's always incremental, so it builds upon the previous year's budget. So if we see that the optometry board had on the budget of 2,285,000, which you could see on the expenditure projections in that yellow current year revised budget column. And then when you factor in the reimbursements and the cost recovery from RDO, it leaves the total net appropriation of 2.193 million. So when we take that into account, when we build a budget, we actually just make incremental adjustments to that. So it's not like we lose the budget. It will most likely actually continuously slightly increase. About 3% or so is kind of the catch-all percentage we use for any anticipated expenditures ongoing. So in terms of losing this appropriation, to some extent, yes, for fiscal year 2020-21, but that will just leave more balance in the fund to allow the board to have more freedom and financial freedom to make any resource decisions through the annual budget process moving forward. Because in order to even ask for resources or request them and get them approved, the board has to display a healthy fund balance. And so these savings, technically, even if they might be considered like losing it, they're just going back into the fund. So that's ultimately good news. And the overall budget building process, in regards to your first question, it does sort of impact, it definitely impacts the board's fund condition and its appropriation, especially when you take into account different things like pro rata, whether that's for DCA pro rata or even statewide pro rata. Those types of things are part of the annual state budget process and have an impact on optometry's budget and fund at the end of the day, especially when, let's say, the statewide pro rata goes up, then, and that's part of the annual budget building process, then that's going to have a negative impact on the board's fund condition. And same thing with the department. If the department puts in requests for numerous DCPs and that has an impact on the pro rata that it charges the board, then that will also have an impact on the board's fund and its budget, actually. So the overall annual budget process does have an impact on the board.
Okay, thank you. That was a clear answer.
Thank you.
This is Member Brandpine. I do have a question. Would you mind walking us through the licenses and permits line, and in particular the budget year, and what is giving us that large jump from the calendar year to the budget year, from 152 to 474?
Yeah, that's a great question. So on the revenue side of the fund condition statement, we do see quite a big jump from 152,000 to 474,000 in the budget year and budget year plus one. And the first instinct that I have is that it has to do with the merger with RDO. So when you combine the revenue that's coming in from RDO, that is definitely going to have an impact, not entirely, because I know for a fact that RDO is not going to make that huge difference. It might add, I'll have to double check my documents, but I know it will add at least somewhere between a few, maybe like 50 to 100,000 at most. The rest of it is sort of a display as of now. There was a workload revenue drill that was completed. It's an annual drill that the department completes in collaboration with every board and bureau. And it takes place in about October every single year. And that's when the board and the budget office work together to establish what we anticipate the revenue will be for not only that current year, but also for the budget year. And then we take that budget year amount, in this case, 474,000, and we just keep it static moving forward. So I'll have to double check how that 474,000 was calculated. But one thing I can say for sure, there's two factors. One is the merger with RDO, which we all know is not going to be super significant, but it's going to have some impact. And the other factor would be that the board anticipated more license and application fee revenue in 21-22 as compared to some of these prior years, as we can see for 19-20 and 21. So that is a number that will get updated in about, like I said, October. So about a month and a half from now, we will be doing that workload revenue drill again as the annual budget building process. And then when the governor's budget comes out in January, we will see all these numbers get updated. So if that 474,000 looks a little too high right now, rest assured we will be fine tuning the numbers if need be. But there could be a chance that some of the staff at the board had some insight regarding an uptick in licenses and applications. So there could very reasonably be a justification behind that huge uptick. I would just have to check the spreadsheets that were used to calculate that.
Agreed. This is Shara. Oh, and I apologize. Just to echo that, essentially, we do have new licenses coming on. We did have some record graduation years in the past. I know that we tried to be conservative in our estimates, so we'll go back and check numbers to see how we develop that 474.
No further questions on my side.
Does anybody else have any questions, Mr. Dollywall? Well, thank you very much for your report.
Of course, absolutely welcome. Thank you for having me, and everyone have a good weekend. Thank you.
You too. Thank you.
Bye-bye.
So then that now takes us on to item number 7 of the agenda, and that is our EO's report. Shara?
Lillian, can we take our morning break at this time?
Thank you very much for reminding me. Yes, let's go ahead and take a 5-minute bio break. Great. Thank you. If we could come back into session, I guess. All right, well, welcome back everybody from our bio break. And I think now we can just move on to item number 7, which is our EO's report. Shara?
Thank you so much, Madam Chair. Thank you all, board. As you know, within the executive officer's report, we take this opportunity to give you updates on our enforcement staff, processing or licensing, and the other parts of administration that we do. So I'm of course going to step aside and allow our subject matter experts to come in here and give you updates. First, we'll have Terry Villarreal, who is our lead licensing analyst, who will talk you through our quarterly statistics, and then begin a presentation on an overview on our enforcement process. And you'll recall that as part of the strategic plan in helping board members to better onboard, we're going to spend the first 2 years of the strategic plan really getting in depth to how we process enforcement and what we do in processing disciplinary actions, and making sure that folks on the board have an understanding of their place within. Oh, I said licensing analyst. Thanks, guys. I'm sorry, enforcement analyst. My helpful friends in chat. But within the strategic plan, that we want to make sure that board members understand their place within the disciplinary process, understand the due diligence that staff takes in order to get those cases to you, and then that we're able to create board-specific, board-driven materials on enforcement for our incoming board members so that they can quickly get up to speed and understand their role in the disciplinary process and feel confident in the closed session hearings that occur for all of you. So I'm going to give it away to Terry, our lead enforcement analyst, and have her start with the quarterly statistics.
Thank you, Shara. Good morning, everyone. I'm not sure if you can see me.
Oh, you're kind of cutting in and out, Terry. We can't see you, but we can sort of hear you.
Okay, is that better? You know, the connection, I'm in the office and sometimes the connection is not the greatest. And okay, let's see. How's that?
It sounds a little bit
Can you
better.
hear
I
me?
think we're getting intermittent views of you. There we go.
Okay. So let me know if that's okay. I'm just gonna talk and see how that goes. So several procedures. So this is a fiscal year date.
Terry, if I may, I think it might be best if you stop running video altogether, and that way
Okay.
maybe audio will be more consistent.
Okay, I will do that. Okay, how's that?
Much better.
Okay. Thank you, Shara. So this is an update for the past fiscal year. It is just an update of what we've been accomplished in the enforcement unit. So enforcement staff, we've created several procedures for tasks that we perform regularly. Because we have new staff and we need solid procedures to hand off to brand new staff. For example, last December, we hired Pink, our enforcement technician, who was brand new to the state. So those training manuals were really important to be updated and consistent with how many of the processes that we do in the unit stay consistent. So we've been working hard to get those up and running, and they are a work in progress. We continue to update those as time goes on and as we improve processes. So those same manuals are going to be used to hopefully create videos to train board members on many of the processes that we do here in the enforcement unit, because one of our goals is to make sure that the board members understand what our enforcement unit is all about and what we strive to do here in the enforcement unit. You know, how we are here to help the consumer. And I know that in the past, there's been a lot of questions on what we do and how we do it. And so we're hoping that with solid assistance, we can make the training manuals videos. So that's, that's coming. So the board said goodbye to two of our analysts. One of them you heard about at the last meeting, Matt McKinney, the senior enforcement analyst. And we lost another great analyst, Alex Juarez. He is at another board within DCA, but still, you know, Alex was a great worker. He was very knowledgeable. He worked a lot of the optician cases. So that was a great loss for us, but he left for promotion. So it was wonderful for him. You know, we miss him. And as I mentioned earlier, Pink is our enforcement technician. She started last December, and Pink continues to strive to learn more. She's taken on a bigger role. She just has developed processes, and she's continuing to learn. She's helped with implementing procedures, making them better. So she's continuing to learn, and she's a great asset for us. So the probation monitoring program has undergone a lot of changes. And some of those changes are us updating, staff updating letters that we sent to probationers and creating binders. And we developed a checklist for probation orientations to make sure that our probationers understand exactly what's expected of them when they are put on probation, because some of the requirements, as you may know, some of the conditions of probation it can be daunting for someone that is newly on probation. And we try to work as much as we can with the probationers to make sure that they stay on track, and to make sure that they are within the conditions, that they are doing what they're supposed to be doing within the conditions of their probation, because their license is at stake, and more importantly, we're here to protect the consumers. So we're continuing to improve that process. And you already, I'm sure, know about the AB 2138, because this has been mentioned in past board meetings. So this was another accomplishment that the enforcement unit had, that the board was able to put in place. It helps reduce I just lost my train of thought. Anyway, it is helping the applicants for the optician program get more of a fair chance to become registered, your licensed registered. And that is about it for the enforcement report. Below, these are the actions that we've taken in the last quarter, in quarter 4. You already have heard about John Sun and Sarah Lampers, and a statement of issues was issued to William George. So continuing on with the fiscal year and statistics, I don't know, maybe I should stop and ask if anyone has any questions before we get into the rest of the enforcement report.
Harry?
Yes.
This is Glenn Kawaguchi. So I do. Where are we at with staffing then? So are we still one technician short?
Well, we are.
Ariel, let me step in. So yes, we are still one technician short. We are backfilling. We have a new hire starting with us on September 1st. So next Wednesday, we're very excited to bring in a experienced candidate who's done enforcement with many other boards within DCA. And then we are going through the hiring process within the enforcement, the hiring process for an analyst who will oversee the creation of our mobile optometric unit legislation or program for that. So we've got an AGPA who we are currently hiring for, who will oversee the creation of the mobile optometric unit program and oversee the development of the enforcement and license review program as well.
Are we getting applicants? Do we have applicants? Is that a problem currently, or has that gotten better?
That has gotten better. Even through, we saw some dips in applicant pools as many folks saw that kind of dip in available labor in the pandemic. But we really have seen some really quality applicants for positions within enforcement. And then also we are hiring for another licensing position as well. So we have some good candidates. It's a matter of, working, of course, through all the paperwork on that as you've got folks going out and folks coming in, getting all of that in the right order, so that, yes, definitely. Thanks. I'm trying not to completely be sidetracked by the chat. But what we'll do is we'll go ahead and make sure that all of you have the job posting for the licensing, or I'm sorry, for the mobile optometric unit analyst that we are currently searching for. And if you've got folks within your network who might be interested in doing some state work, would love to have you also share so that we can get a wider pool. But no, we are having good interest and finding quality candidates. And then, of course, good people, you can't just immediately snatch them from their previous employer either. So, navigating those timelines of when we can get folks to start as well.
What are you talking about? They keep getting snatched from us.
It's true.
That's true. Didn't think of it like that. Okay, so continuing on with the enforcement chart by fiscal year, you'll see that it's quarter one. You have already seen the statistics for quarter 1s, 2, and 3. We attached quarter 4. So this is a broad picture of the last fiscal year by quarter. Cases received and closed, as you can see here, and the other information on this chart. The the received cases did increase for the fourth quarter. That could be because we're back in the office. More of us are back in the office. Maybe it's the forefront in some consumers' minds, opening of cases. So I don't know if anyone has any questions on the chart. If not, I'll continue on down. Okay, so the next.
Sorry, Terry, it's Mark Mordomi. I had problems finding my mute button.
Okay.
I'm looking at quarter 4.
Okay.
There's a high profile matter. Let's see now. Let me look at this if I understand it. Average days to close a case. It looks like. Okay, so this is, well, the number has gone from. There's a one. Anyway, I see a 633.
Yes.
Which looks like it's a lot higher. Well, it's higher than the prior 2 quarters. Can you say anything about that?
So you're looking at the average days closed. Let's see. I'm just trying to get on the same. So for quarter 1, it's the highest.
Right.
And for quarter 2, it's significantly lower.
Right.
The same for quarter 3.
Right.
It's not that much higher for quarter 4.
I'm looking at the high priority cases column.
So the high priority case in quarter 2 was 470 days. In quarter 3 for optometry, it was 242 days. And then now quarter 4 at 633.
So what you'll see here, board members, is that this is particularly within opticianry. One of the reasons why we were so sad to lose Alex is that he'd been working really diligently on developing our citation program, and that there had been several cases sitting unresolved. And so he developed a system by which we were able to close out some older cases. And so that jump is, you'll see, oh, I apologize. You are looking at an optometry. 633 is what you're looking at, isn't it?
Right.
Yeah.
Average days to close. So I just wanted an opportunity to praise Alex. I apologize because actually his work was a good part of that. You'll see down in average days pending, there's also that jump to 740 over an optician rate. So this is a function of cases having been reassigned for several years with the turnover of staff. And we are now trying to make a more concerted effort to close out those cases that are older, that have been sitting. And so you'll start to see our numbers, unfortunately, days to close increase for a bit as we close out those older cases, and then finally decrease as we get that backlog taken care of.
Okay. Well, I'm not advocating closing cases that still require work. On the other hand, these are high priority cases. So I think our definition of high priority is, someone being injured or a sexual harassment case. I forget there's a third category. So, we really need to put efforts into resolving these cases, either closing them because we can't have the evidence, or prosecuting them.
Can I just say the high priority cases do require a lot more time and investigation because a lot of the times need to be sent off to other places. Sometimes they could be sent to Division of Investigation. Sometimes they could be sent to a subject matter expert, and that's going to extend the time of the closing of the case.
So that's good to know. If I were to I was asked about this before the legislature, and one of the senators or assembly member asked, well, if it's a problem with Department of Investigations or the Attorney General's office, what's the problem and what can the legislature do about it? So I'll state kind of an open-ended question is, consider what the problem is, and if it's another agency, and what can we as board members do about it to have them address our high priority cases in a much more prudent fashion. I mean, if we have to go to the legislature and say that this office is another office is delaying our high priority cases, then that's what we have to do, or you have to reach out
I think we
ourselves to
want
those
it.
departments.
Certainly. And so that's a lot of our strategy in trying to better manage our caseload, understanding where we can push along cases that are out with Division of Investigation. But I think it's also important that we own our piece on this too, that we as board staff own the piece on this. That through transition and leaving of staff, cases have been shuffled and reshuffled. We're really trying our best to marshal resources in order for us to approach our caseload as a whole unit, as opposed to individual silos. If you've got a 94, caseload, 94 cases in front of you as an analyst, and you know that you've got to meet your numbers, you're going to work on those that you can close out in order to show that you're producing and that you're working on. And so, of course, we can't blame each individual analyst who's been with us over the last several years for that mentality, but it has come a time where we as a board, that I as EO, that we as enforcement unit are really better managing all of our cases to better perform in our performance management metrics, and the next time that we sit up in front of the legislature. Mark, I agree with you. So yes, there are certainly, again, marshaling our resources to understand where we can move DFI along, and where we can work better with the Attorney General's office, but also our program more strategically managing our caseload and the cases that we have before us.
Yeah, my concerns are more the high priority cases, and that, I get the numbers. I mean, I picked out a number. I just want to make sure that cases where people are injured or the consumer is really going to be harmed, that we zap those respondents sooner rather than later.
And that is certainly, so I think also too, it's important to know that high priority does include those where there's a loss of vision, or where there has been a sexual assault or harassment. But then it also does include, because within, optometry, it's also, lesser offenses. It's not always what comes out to a loss of vision. It's oftentimes a failure to refer. Within our optician program, it could be that we really have to make an effort in going after more unlicensed practice, but that can be difficult to prove. And so it really is, with all of our caseload, better managing that. High includes a range of cases, but then better managing our caseload as a unit, so that we know that we are, we don't have folks who have 94 cases on their desk, and that, the things that might be, and not egregious, right? Anything that is egregious, we're immediately addressing. But I think that there are times in the past when we've had particularly, opticians, I'm sorry, unlicensed practice issues. And that, again, those are difficult to prove. And so, that case might sit a bit. Is there an opportunity for patient harm? There is. We don't want someone, fitting and adjusting glasses without the proper certification. But we know we're also working on all of that on the legislative end too. So I want to assuage any fears of the board that where there are things as egregious as loss of vision or sexual assault or sexual harassment, that we are immediately looking into those cases and moving as quickly as possible in removing that licensee or ensuring that consumers are not harmed. But within high priority, you're going to get, like I said, failures to refer. You're going to get unpracticed license or unlicensed practice within opticianry particularly. And so really our ability to not have those spread across 4 desks, but to come up and say, okay, everybody's got 94 cases. Now let's really take a look at, it might have been a loss of vision, but that's right. We've got multiple complaints on this RDO for unlicensed practice. Let's elevate that now and make sure that we can come in and marshal the resources, work with DOI to have an effective and, strike investigation in order to get us the proof that we need in order to move forward. So assuage any fears that we're not immediately going after loss of vision, sexual assault, sexual harassment. But there really is at this point a need for the unit to manage all of the cases in a more strategic way so that we can move through the things that have kind of been in that backlog and shuffled around.
Are you done, Mark? Because I have a attached comment question.
Oh yes, I'm done. Thank you, Shara and Terry.
Yeah, thanks to both of you. So my comment / question is, in the report, I feel like some of the strategies, Shara, that you're sharing are being addressed. So for us to make sure that our productivity is not the concern, it takes training, it takes strategy of execution, balancing the staff. But going back to my original questions around staffing, I know that sometimes for us there's staffing that we have currently approved, and there's also staffing that we have to try to add, and trying to add staffing, as many of the board members know, is a very long process because it takes a budget change approval. And I want to make sure that we're always mindful as the programs are evolving, as we're looking at numbers, that we're thinking far in advance if we are going to need additional staffing, that we're working on it far enough ahead of time because it takes such a long time to achieve.
And with that I will give a shout out to Brad Garding and Cherie Kimball, who have been a part of that process over the last 3 months, working lots of overtime in order to look ahead to the next fiscal year and what it is that we will need in order to improve the management of our unit.
Thank you. Thank you to both of them.
Oh, I have a question. Just based on some of these numbers, seem really high, and I was just curious if you were to just say, remove like some of the 2 longest pending cases or something like that, do you think that would dramatically decrease the average number of days to close a case?
So that's a really good question, and one that we need to analyze the caseload that we have, the unit caseload, in order to find that out. We are looking at those things, and that oftentimes, again, if you do close something that's been pending for a long time, then it will, of course, shoot those numbers up. And so I think we're all kind of circling the same, sort of hole, that we've really got to take a look at the data on our cases and figure out, okay, what do we meet out to analysts in order to quickly work on that, it might have been sitting for a bit. Maybe we did engage DOI, but we didn't get exactly what we wanted. How do we analyze those cases at a higher level in order to figure out how we can move those through so that we see sort of a uptick, right? As we're moving through that backlog. and then we can bring ourselves back down to working our regular caseload, which we are really able to get through a majority of. We receive about 350 cases a year, and we're usually able to close about 300 cases to 325 cases each year, with a few lagging, a few coming back on the end. So our staff does a really great job of moving through the cases that we're getting. It really is just going back to those cases that have been sitting that maybe, the analyst wasn't sure about the next best step, or, we didn't get what we needed from DOI, or, whatever the circumstances might be, that there really does need to be that analysis of our full caseload in order to figure out, right, what the peaks are going to be in closing times, and how we can best work all of that load in order to, make these numbers back to where we want them to be.
Okay, any other questions before we move on? Okay, so we're going to move on to agenda item number 7A, case investigation overview. As I mentioned a little while ago, I know that the board has been interested in how we handle cases and what the exact process is. So over the next several board meetings and the next couple of years, we are going to put together trainings that we're going to present at board meetings to better give the board members an understanding of the entire complaint process from start to finish. We're going to cover different subjects. Today's subject is just the basic overview of how a case is handled once it's filed with us. In the coming months, within a couple of years, we're going to get into how we handle advertising cases, how we handle disciplinary action cases and whatnot. But today is just the basic overview of a case. So cases. So yeah, we're going to talk about how cases are received, from what sources, and the high-level processes required for each desk investigation. So cases are received through Breeze, the board's electronic program. You go into Breeze to renew your license, to apply for a license, and you can also go into Breeze to file a complaint. Complaints are also received through email, and they're also received through the mail. Sometimes we get telephone calls from individuals who want us to mail them a complaint form, and we do that. So those are the ones that we receive by mail. And sometimes we receive, not often, but sometimes we receive complaints from DCA's call center, and those complaints come directly to me, and I'll either open it or I'll give it to Pink, and she'll open it. So each case is received and opened and investigated. Investigations widely vary case to case, but the basic determination is that we use, that all of the enforcement analysts use, is very basic. Has a violation of the Optometry Practice Act occurred? That's how we make our basic determination, is have laws been violated.
I'm sorry to interrupt, Terry. If we can have folks advance the slide, so we can match up with Terry. So we'll give folks a moment to linger. Right, okay. That's where we are. Basic determination.
Okay, right. I'm sorry. I'm reading off.
No, Terry. No. We're trying to give you some help. I want you to focus on your presentation and interacting with the board and hearing their questions. We're on the background, making sure that in technical chat we can advance slides for you, and you can not have to take on all of it.
Okay. Okay. So we okay. Let's see. Where was I? So the board's mission is to protect consumers, and cases are investigated with this in mind. I explained how we receive cases. So they're through Breeze and whatnot. Okay, sorry, I lost my train of thought there for a second. The board also investigates criminal convictions as part of the applicant process for licensure. So this has to do with, well, this is for opticians and for optometrists. We receive reports from the Department of Justice and from the FBI in relation to fingerprints, and if there is a violation, we're told of that in a report that we receive called a rat sheet. It's the program with the FBI is called the Rat Back program, and it'll tell us what the violations are against the optometrist or the applicant optometrist or optician. So that's another way that we receive complaints. So at intake, if a complaint includes a request that is outside of the board's jurisdiction, for example, if the complaint is against a licensee of another board, or if it's a request for funds, the return of funds, reimbursement of funds, or benefits, or if it's a purported violation of HIPAA, and even in relation to COVID, we don't have jurisdiction over those complaints. And we contact the individual that filed the complaint and we let them know. We don't have jurisdiction over this, but we'll tell you who does. And we provide that information, that entity's information to the complainant. That's one of the things they ask us, do you have that website? Do you have that phone number? We always try to help out complainants because oftentimes when they contact us, they're upset. They lost hundreds of dollars. They can't find anyone to listen to them. So we're kind of, I don't want to say the last stop, but, we try to provide great customer service, to everyone. So when the case is opened, it's assigned to an analyst for investigation. The analyst will review the documents that were included with the complaint documents, and sometimes, a lot of the times, we don't receive the required documents that we need. So we'll have to write to either obtain police reports, court records, notifications from insurance companies if we receive a case in relation to a settlement. A lot of the times, we'll have to write to the subject to obtain medical records. We need billings and just different information so we can put the puzzle together. So we have all the information to make a solid determination if there was a violation of the Optometry Practice Act. And sometimes this can take a lot of time because requesting medical records, requesting police reports, it can take months. Not always, but it can. So each case is entered by Pink into Breeze. She's our technician that enters the complaints, and she assigns them to whomever they should go to. And they're given a priority ranking. Cases just with a standard priority are those where a complainant wants their money back, but they also either want an apology, or sometimes they say, I want my money back, but I also want my glasses because I feel like I've been wronged. Well, we write to them and we say, we can't get your money back for you, but, we'll write to the subject and say, can you address this issue? So we try to do that. Billing errors is also another billing errors, problems with prescriptions, copies of medical records that complainants have requested. Those are also things that we try to get from subjects because those are a lot of the requests that we get. In relation to the high priority cases, like Shara mentioned earlier, we give those high priority because those can be the loss of vision. Someone, a licensee has missed a diagnosis. A common one that I have seen with my short time at the board is a retinal tear, for example. Another high priority case would be sexual harassment or an assault. So those are given high priority cases. And so we do receive about 350 cases per year on an average. So that's a lot of cases for a small board. The analysts, enforcement analysts, we work with subject matter experts to determine if we can't make a determination, if there was a violation of the Practice Act, then that's why we would utilize a subject matter expert, which is a licensee, an optometrist, and we would send the case to them and ask them to, for their opinion. And they send us back a report and they provide what determination based on the Optometry Practice Act if there were any violations made. We also work with closely with the Attorney General's office when we have to send cases there for formal disciplinary action, which could be an accusation. It could be a statement of issues if it's an applicant. If we're denying an application, that's where the statement of issues would come into play. The analysts also work with the Attorney General's office with the Deputy Attorney Generals to temporarily suspend a license if there is an immediate potential for harm, or if a consumer to a consumer. And that also can mean if there's mental or physical health issues that we feel that need immediate attention. So the table below is just a kind of a synopsis of the history of what a case goes through. So you'll see that the first one is review new complaint for jurisdiction and completeness. And the list just goes on in relation to desk investigations. So these are all the steps that an analyst will take, that staff take to get through a complaint. And you can see that it can be a lot of entry, a lot of back and forth, a lot of information that we have to come up with and enter into Breeze and prepare. For example, number 26, it says draft a citation. That requires a lot of information. We have to look up the complaint number. We have to enter the causes for citation, whether it is the, I can't think of some right now, but just preparing these documents take a lot of time. It's just not one document. Oftentimes it needs to be prepared. It's several that we have to prepare in order to just get to one decision or one action. Any questions? Maybe I should stop and ask if there's any questions before I go on.
This is Mark. Char, how do you want to do this? I have 4 items that I'd like more information on, probably from a later meeting. I can save that to the end, or I can ask them now. I know there's a
That sounds great. So this is definitely the overview, which is where we're kind of starting. We're hoping that today's presentation will pique your interest. At the end of Terry's presentation, we certainly want to talk about topics that we should have individual trainings for. So I think it sounds like, Mark, what you've got are 4 ideas for individual training. So we would come back to you, say, spring of next year, and we would talk about one of the items that you've got. And so we'd spend our 20 to 25 minutes in depth on a particular issue. Does that sound about right?
That's fine. I mean, I have 4 questions. Some are long term, some may be answerable by you or Terry immediately. You just tell me when you want me to fire them off.
Yeah, no, then let's do the short-term questions now. And then if there's, a more in-depth look at a subject matter, then let's say that for the end of the presentation, we'll pull together our list of suggested trainings that we'll have staff continue to work on over the next couple of meetings.
Well, I'll tell you what, I'll ask them now, and if you tell me that they are long-term, we can park them and, okay.
Sounds good.
All right. So thank you for indulging me. I know we've said that certain classes of cases are high priority, and I think we all agree that what what cases should be a high priority. But mechanism wide, what does that mean in terms of what happens to the cases, or what staff does, or what our procedures, how our procedures might change, or how staff is instructed, or how staff is encouraged to work on the case, or get compliments for dealing with high priority cases. So yeah, it's a high priority case. So the question is, so what? Second question, is there any avenue for proactive opening of cases? Most consumer agencies open cases based on solely on complaints. But what if someone, Shara, for example, or one of the enforcement analysts sees an article in the Sacramento Bee that a consumer says, I went into Joe's optometry shop, the sign said free glasses, and I went in and they charged me $700 for glasses. They're defrauding the consumer. Do we sit back and wait and say, oh, well, there's been no complaint filed and therefore we can't open a case? Or can staff proactively open a case?
We can certainly proactively open a case. There was actually a funny incident just a few months ago. I was looking through a community. I think it was actually a brochure for Crocker Art Museum, and there was an RDO listed that is in the general Sacramento area. And I said to folks, "Yep, that's right." Hey, let's look up the number on this. And so we certainly, as staff, are keeping our eyes out. And if there is, in fact, I think that there's a misconception with folks that somehow or another the consumer complaint is also only for consumers. If other licensees see violations, if individuals see violations, if we see something reported in a newspaper or something that looks untoward in a Yelp review, then we certainly have the authority and have in the past opened up cases in order to address that. One of the things pie in the sky I'd love to be able to do, as we said earlier, that unlicensed practice is a big issue within the opticianry program. When we have staff time, simply working from, Google search can give you an opportunity to pull in listings and addresses and advertisements for opticians who aren't registered with the board, or who might not be in full compliance. And our ability and bandwidth in order to just do those sorts of proactive research, we would love to be able to do. So if we do find something out in the community or out among consumers that isn't the direct response of a patient making a complaint, we definitely do still open cases in order to address that.
Thank you. All right. Topic 3 is an explanation as the difference between a citation and an accusation. I know the EO issues citations and imposes some financial penalties, and then we see we usually don't see all those cases, but we do see accusations. So I'd like to know the difference between those two enforcement avenues. And then finally, last, I'd like a lot more on the interim suspension orders. I think as a board, we've seen cases where people have lost their vision, and the administrative enforcement process kind of trickles up to us, and it's a very long process. We have to, um, uh, have a hearing and whatnot, set months down the line for um, on the person's license. And the board's quandary is, well, gee, we either have to accept this kind of mediocre settlement or let the practitioner practice all this time before a full hearing is set. Particularly in loss of vision cases, is there any analysis as to whether an interim suspension order is appropriate? Right. Yes, that's the early in the process, because of the consumer harm that's happening. So those are my 4 areas, and you've answered one already. So Thank you.
Of course.
So
I apologize. Go right on ahead.
Okay. The difference between a citation and an accusation. A citation is it's a monetary type of discipline that can be imposed on an unlicensed person or a licensed person. If we ask them to correct something over and over, for example, if they are if they're advertising not within the scope of their business that they should be in relation to the Practice Act, then we issue them a citation, and we spell out the reasons, and we quote the law in each section of the citation. Sometimes a citation can have more than one cause for. It's not cause for action. It's just a cause. I can't think of the correct term right now, but that type of thing is where we issue citations. Sometimes licensees don't complete their CE a requirement of hours, and they're issued a citation for that. So that is where the citations come in. So an accusation is where the act is what a licensee does is more along the lines of more egregious. They've missed a diagnosis. They didn't catch something. So, like a retinal tear. I know that you asked about a interim suspension order, but it would be a violation of. It would be something like that. It would be it would be something something in relation to the health of the eye. Also, it could be a sexual assault. It could be and something in relation to that. So that is also an accusation is issued. That type of case will be forwarded to the Attorney General's office, and that's called a formal discipline. Does that explain it? Does that
Pretty
answer your
much. I'm sure I may have some questions later, but thank you. I mean, you mentioned the citations related to false advertising. I think later on we may want to have a discussion on how those those things are charged. Is it 1 count, 10 counts? But that can be set for a later discussion.
And I just want to give both Cherie and Brad, who are promoted to panelists, to have an opportunity to support their colleague if you'd like to chime in with some examples. I think where I want to start, and then I'll leave off for enforcement, is that we do always try to gain compliance. So the lowest level of enforcement possible. If we are able to gain compliance, then there isn't a need to move to a citation. There isn't a need to move to, a possible statement of issues or accusation an accusation. That particularly on something like advertising, if we can encourage the licensee to read the statute and to review their materials and to find the violations that have occurred, then we're able to close the case at compliance. And so we certainly do at every turn try to give folks access to the law and help them remediate at the lowest level, gain compliance before we look at issuing citations, either public rebuke or some sort of fine. I don't know if any of our other enforcement analysts want to step in.
Yeah, Brett Garding here. Mr. Moridomi, I believe your question centered around the differences between citations and administrative actions like accusations. So citations are when we're not able to gain compliance after trying to. That's typically what we issue citations for. Sometimes we have in the past for like DUIs and things of that nature, but a lot of them have been advertising related. And some like failure to complete, to do their CE, and then they're doing the renewal before their CE is done. those types of things. But for accusation, it's more serious matters like multiple DUIs or they've injured a patient or something like that. That's kind of the threshold of where we would go after their license. I hope that that clears it up a little bit.
That does, although I'm sorry, it begs another question for me is, we as board members never see what kind of citations or the amount of citations that are being issued or any of that, right? I mean, we don't need to see the individual citations, but in the enforcement report, do we ever see how many citations were issued or agreed to by respondents in any given year?
I believe those are in the report. I'll have to defer back to Terry and Shara.
You know, once they become final, we can start putting them in the enforcement report for the board members viewing. You can go onto the board's website and look at the citations that we have issued that have become final in the past, but we can start including them in the enforcement report in the board packet. We don't issue as many as other boards, but we do issue them.
I think that's a great idea. It had great deterrent effect, but I leave it to Shara and the staff to determine how much work that will be.
And also too, just of course, those citations are made public on our website, and they are also tracked by the NPD database, national database.
Oh yes, and another thing about citations is that we can issue citations against unlicensed individuals who have violated optometry and optician laws, where we wouldn't be able to file an accusation.
Thanks. I have no further questions.
Okay. There's a small little section that is left on my presentation. If there aren't any other questions, I'll continue. So after the analyst has all of the information for the case, the police report, if one is required, all of the documents from the consumer, from the subject that we have requested, then the analyst takes all that information and it's analyzed, and they analyze it, and then they write what's called a recommendation. So the recommendation is a synopsis of what the case is about and what the discipline, if any, that the analyst is recommending for the subject. So a recommendation could say, I recommend this case be sent to DFI for further investigation. I recommend that this case be sent to the Attorney General's office because there was patient harm. Or the recommendation could say, there's no violation. I've reviewed all of the, I've analyzed and reviewed all of the evidence that pertains to this case. And based on the laws in the Practice Act, there's not a violation. And my recommendation is to close the case and either maybe, educate the subject or just close the case, no violation. And so those recommendations are reviewed by myself, the lead enforcement analyst, and by our assistant executive officer, Cherie. And sometimes those recommendations are reviewed by Shara, if our executive officer. If the analyst recommends that the case should be sent to the Attorney General's office, Shara does review those cases to see, so she can have a better handle on what's sent there. So she can keep track of that, and to see if the analyst is on track with what they should be in relation to the laws and the Practice Act, and if everything makes sense in relation to the case. So that is about it. So this was just a basic overview. I know we kind of got into a little bit more detail, but please provide your feedback in relation to this presentation. Just, was it clear? Was it concise? Do you understand? Do you have a better understanding of how just the basic case review is handled and how the board receives cases? Or was it not clear? Would you like more information? I know that Mr. Mordomi wants more information on the interim suspension order. So that will come in a different presentation. But that's all I have.
Hey, Terry, this is Dr. Garcia. First, I want to say thank you. That was an excellent presentation. I'm glad that the staff are putting these trainings on for the board members. I think it clears up a lot of misinformation or lack of information on exactly what you do day to day. So I really appreciate it. Thank you.
You're welcome.
I did have a comment, and I'm not sure if this is the right time, but just for maybe a future training. I know I've been working with Shara on some of this, maybe on one on social media and advertising, because I know that some of our Optometry Practice Act laws have been in place for a long time and maybe have not kept up with social media and advertising. So I suspect there's probably a lot of disconnect out there with practitioners using social media. And personally, I can also say that's true. So, for example, with Twitter and Facebook, that's a real big way for us to advertise and practice. But as we know in social media, even on websites, you have to have a unique name, and sometimes those unique names don't line up with our fictitious name permit or practice names. So those are technical violations. Is there some way to maybe update some of those rules on social media and maybe line those up a little bit better with how people are using it today in 2021 and not in 1999?
That might
Garcia, oh, sorry.
Sorry.
I was just going to make a joke. Dr. Garcia, you're not using the yellow pages as your biggest form of advertisement?
I remember not too long ago when I first got into practice advertising in the yellow pages was kind of taboo, back in the old days of 1980s optometry. But again, things have changed so much. Even when I first started in advertising yellow pages, it was kind of a negative thing to do. But we have come such a long way, and maybe our marketing and advertising laws have not been able to keep up with all those advancements.
And I think we've come to this sort of discussion before in Practice and Education Committee as well. So I think the intention is that we will certainly do a session specifically on advertising statutes and how we go about helping licensees comply and the communication that we have with them. But I think also too that it will be a good idea to have a larger discussion about whether or not there are things that aren't addressed or aren't addressed appropriately within the current statute. So we'll certainly include that in the list of trainings and provide some time within the agenda to have that larger discussion.
Thank you, Sharon. Again, thank you, staff. Great presentation.
Thanks. It was a group effort for sure.
Terry, it's Glenn Kawaguchi. So thank you for the presentation. I especially liked your list of, how many was it? 39 steps, which as you were talking, there were more steps that you didn't include in the list. One of the things that Mark and I had talked about in the past was when we would have hearings, the questions that were coming from the board, we could tell that there wasn't a clear understanding of the processes that had been in place leading us up to that point. And so I think this is a really big step forward for us as a board. And as you look forward to sharing this as we gain new board members over time, keep the presentation nice and simple like this. This is a nice overview. But thank you for putting this together. I appreciate it.
Thank you. We are going to try to keep them simple. It may get a little, we're going to try to make it as simple as we can, but it may get a little more in depth as we talk about the cases sent to the Attorney General's office, but we'll try to keep that as simple as we can. So yeah, we're going to steadfastly work on more trainings for you all, so you'll understand what we do here in the enforcement unit.
Were there any other key areas that board members wanted to add to our list of in-depth trainings? And I think likely what we'll do also is that we'll bring to Consumer Protection and Outreach Committee our list and sort of talk through what else could be added to that. And I think that might give an opportunity. I can see Sid stewing, and Sid is as chair of that committee. I think it would be a great opportunity for us to think about, what are the topics that continue to come up as board members go through closed session and sort of understanding their role within the disciplinary process. So I'm making my notes so that we'll add that to a future agenda item to look over those topics. And as we develop the list over the next, several months and bring these trainings to you.
Shar, this is Dr. Garcia again. So this is not an enforcement topic, but maybe something on the process of licensing new graduates from A to Z, how that process happens. I think that'd be interesting to hear. I know there's a lot involved with that.
Yes, there is. So we're going to actually, that is our next item. We'll do a top level kind of overview. But I think, then we'll certainly can do the same and get a more in depth at this time of graduation season. I know folks are getting, calls and tickles and, emails about, my license and has it been done yet? And so we're going to give some of that information today, and then the same. I think that it's a really great opportunity to kind of figure out where folks might need more transparency. So thank you, much appreciated.
This is Sid Bramvine, Executive Officer. You read my mind. So if we could have an overview of what communications plan we have, the channels that we're currently using, examples of what's going into those, sent over to the committee, then that would help us understand what our next steps are too, to help coach and guide as we're looking to enhance our public outreach in general, especially with respect to consumer protection.
That sounds great. And I apologize, President Wong. I think I sort of stepped on your duty, is that it is your prerogative to assign topics to the committee of your choosing. So I will also say that, President Wong and I will have a conversation and see if there are other committees where a more in-depth kind of discussion and brain kind of trust might be a good idea as well.
I was 100% in agreement with you, Shara. So, all right. So thank you, Terry. That was very, very informative. I think it was especially great for all of our new board members to really understand the enforcement process.
Thank you.
So if there's no more questions for Terry, Dr. Garcia just led us right into our next subject, and that's the licensing process. So Shara and Natalia could talk to us about that. That would be great.
I don't know. I know that I don't sing Natalia's praises enough, so I'm going to step back and just remind everybody that Natalia really is overseeing and personally does all of our licensing. So there isn't a license that this board issues that Natalia doesn't touch, whether it's the review of the application or the approval of the review that's been done by another staff member. And I know, I sing her praises because I want to make sure we keep her. Nat has just been a phenomenal asset to this board, and she works so very diligently and so very critically to do her absolute best to cover a whole lot of ground for our entire licensing unit. So I'm going to step aside and let Nat marvel all of you with her understanding of all of our licensing program.
Thank you, Shara. So I'm just going to go ahead and jump right into it. What I have listed today is our usual memo. And then after that, we'll go in depth with the stats because I know we have 2 new board members, so I want to be able to explain those to you. And then we're also going to go through that licensing overview that Dr. Garcia wanted to hear about. So for our memo this board meeting, we've been looking on how the California Laws and Regs examination did over the last fiscal year. And we're really proud to see the number that 90% of candidates passed within the last fiscal year. We feel like that's a really good number. We do want to bring that up. So I'm looking into ways we can provide additional information to our candidates for the next graduating class. So for our optometry licensing, we are still currently processing our graduation applications as quickly as we can. We are reintegrating an AGPA position to assist with the processing applications, but it's slow going. We've definitely still been doing outreach to these licensees to make sure they understand what they need. And I've been making additional changes in Breeze to make the processing of those applications smoother. For an example, I'm doing an adjustment to the application that requires applicants to put in their OE tracker number. So it's easy for staff to access and go to NBEO and find that information right there without having to track it down in emails from NBEO. For opticianry, we're unfortunately still missing a staff member for that, so we are doing our best. There was a situation where we had a backlog of our registered dispensing optician businesses, and we're working to bring that back up to where it should be. Staff is confident we can bring that back up to a reasonable level fairly soon. And so for our statistics, I have both the 2020 fiscal year so we can look back a year in review and see what that looks like. Our first page has what our licensing populations are as of the fiscal year. You can see that we still have like a lot of our optometry applicants have been renewing. There are almost 6,000 people who are continuously renewing, probably more. Statement of license for the pictures and name permits are pretty much the same as they've always been, and we can see an increase in our optician population from what they used to be. Unfortunately, we still have a high spectacle lens dispenser delinquent number, and staff has always been working towards communicating with those individuals to find out why they're not renewing and to encourage them to renew. And the next page is our processing time by volume. And you can kind of see by each license type how long it takes to approve those applications. You can kind of see that our processing time for our optometrist licenses was around 68 days. So that's around 9 weeks. We're really proud of that number. We do want to keep bringing that down for the next fiscal year. But with graduation season right now, that number is a little bit higher, and we'll go over that in the 2021 fiscal year statistics. As for everything else, you can kind of see where the registered dispensing optician one was not processed as well as we would like. But again, we are working towards that. And the next several pages are visual comparisons for the statistics that are listed above. If something visual is easier for you to understand, that information is there. Let's go down and look at 2021. It's way down there. Okay, so here you can see that the licensee population is not very different than it was before, very consistent numbers. And for the application volume and processing time, there seems to be some kind of error when I ran the report. I do not think this is the online volume is correct. However, the processing time is correct. So the
Nat, can I stop you for just 1 second? I'm sorry. Will you tell us which page of your report you're reviewing? I just want to make sure that I'm looking at the correct data.
Right, yeah. Give me 1 second.
I think it's a 1 through 10.
Yeah, page 2 of 10 with the second statistics. I do not have the large meeting materials document. I just have this number item selected.
That should be fine. I think that gives us all an opportunity to catch up with her. Page 2 of 10 in the licensing application or licensing application and volume processing times.
For 2021. It restarts with 21 from 2020.
There we go. Thank you. That's exactly what you were saying. Able to follow. I guess I was really just
Apologies,
asking
I
for
know I move
myself.
fast.
It's page 20 out of 41 out of the additional packet material that was sent out.
Thank you so much, Dr. Wong.
Let me know when you're ready for me to continue. Okay, so go over this page again. The online volume number is incorrect, and I intend to contact our Breeze team to figure out why that is, but the processing time is correct. That is the correct number. As you can see, processing time went up to 76 days, which is getting more to 10, 11 weeks, which is projected. We're still in the middle of the graduation season, so that's unsurprising. And you can see here how the registered dispensing optician had that backlog at 209 days. So we're closing that gap, and that number will look better in future reports. So the next part of my presentation is the licensing overview. So if I could get presenter status, that would be great.
This is the moderator, and you have been made the presenter, Natalia.
Okay. That's not the right one. Apologies. Okay. So some board members may be very familiar with this. This is very similar to the presentation I give to new graduates when I present to the schools. So this is a review of our optometry licensing program. It's in 3 sections. The first one is going to be our initial applications. The second is how we handle renewals. And the third is going to be our reinstatement and restoration process. And I will break it up for questions for each one. So this is going to be our application process. All of our applications are done on Breeze. It covers everything from applying for the license to renewing the license to pay via credit card, apply for renewals, and apply for different certification types. It's a very important resource for our licensees and applicants, and we highly encourage them to all use it. Starting an application is most of our applicants need to create an account and do a new application for exam request application. This name has been changed from the screenshot to say optometrist exam request application to be more specific, so licensees and candidates are more familiar with which one they're supposed to be clicking. When they submit this application, we highly encourage applicants to include a phone number and email for easy contact. Without that email, PSI is unable to contact candidates in a timely fashion to make sure they're able to take their exam. So scheduling the exam, I mentioned that PSI will contact the applicant to schedule the exam, either email or mail. We don't contact the candidates directly. PSI handles that after we send them the information automatically. Typically, the applicant will be contacted within 2 weeks of submission of the application, about 5 days if they submit via email. PSI locations are located all over the US. Fortunately, they are not located in Canada, but they are located here in the US. And study guides are sent out to applicants on how to take the exam with the email or mail with the information on how to schedule. If applicants fail the exam, they will need to wait 6 months to retake it. And that's because we change out the exam every 6 months. But once they pass the exam, that exam is valid for 5 years after the applicant passes. So if they want to pass the exam, but they're going to be practicing in Oregon for a year, they can pass it now and worry about applying for part 2 of the application later on down the road. So now that they've passed the CRE, they're going to do the next part of the application process, which is the initial license application part 2. This is the bulk of the application. This is the meat of it. This is where the licensing analysts, such as myself, will actually look and review at them hands-on. Required documents before submittal is transcripts and their NBEO scores, and it's not listed here, but they're also required to provide a photo as well. You can see here in the screenshot has manage your applications, and it has the optometrist and the file number, and they have to select additional license. So I mentioned that licensing analysts review the application. This is a little bit on how we do that. We verify that we have received all the required documents, whether it's a scanned file from the transcripts received via mail or something that was submitted to us via email, or if they attached it to the application itself. If all requirements are met, the licensing analyst issues a license right then and there. If the applicant is missing items of information, we will contact the applicant either via email if they have one or mail if they don't. And licenses right now cannot be issued until the application meets all the requirements.
Natalia, this is Dr. Wong, can I ask you a question? So if they're missing material once you've reviewed their packet, do they then go to the back of the line until?
They do enter another queue. It's not going to be as long as a wait as the 10 to 11 weeks that it is right now. But they are entered in another queue of people who have submitted additional documentation who also need to be re-reviewed. We unfortunately have a lot of people who miss these documents. So we do have a separate queue we call re-reviews, and that varies based on how many people need to submit documents.
Gotcha. Thank you.
And so I mentioned license requirements a little bit. We're going to go more in depth in that. All applicants, of course, must graduate from an accredited school of optometry. We have, most of the schools are here in the US, but we do have 2 schools in Canada we also accept from. They also have to pass all parts of the NBEO and TMOD. And they also need to provide that photo I was mentioning, as well as the live scan fingerprint, or they can also do hard cards. State applicants must also provide letters of good standing from all licensed states. And of course, they need to hard cards if they're not able to come here to California to do the live scan. So that's all of the initial application process. Are there any questions about that before I move on to renewals?
Hi, this is Joe Pruitt. I just had a question about the law exam. I was wondering, in addition to the pass-fail rate, do you receive information or a breakdown on individual questions or perhaps topics to kind of see the percentage of how many has answered correctly versus incorrectly?
I have never looked into that information, so I don't know if PSI provides that information. There are a number of reports that I'm allowed to run in PSI's site through our portal. That's definitely something I can look into and provide that at a future board meeting if that's what you would like.
If you don't mind, Natalia, I'll just jump in, Dr. Pruitt. So we have a great partner within the Department of Consumer Affairs. It's the Office of Professional Exam Services, OPES is how we often, or OPES. Dr. Heidi Linser has come to before this board many times before, and you will certainly see her again soon. She's been a fantastic partner for our board. So when we come to the next cycle, right, every 6 months, we create a new exam. When we come to that next cycle, we certainly do review. We don't. The examaticians, they review the questions that were, the positively, yes, you see what I'm saying, the correct answer rates. There's also always within the CLRE some test questions. So generally, the exam itself is about 50 standard or tweaked standard, and then that have been worked through several workshops. So may have in some form or another appeared on an earlier form of the test. And then usually about 15 of the items are some that were maybe developed at the last session or the session before that address possibly changes in the law or communicate the questions differently. And so we use those test questions. I have to be sure that it's the examinatricians, that they use that data to then develop the next bank of questions. So we're always looking at how students perform on the test, how they perform on individual questions, and then how we can better assess. And so we do at the start of that next cycle, we take a look with our subject matter experts at the questions that where students did not as well, and talk about the ways in which that test question might be improved, or any possible sort of barriers to their understanding how the law works and what they should do in practice.
And just to add to what Shara said, those 15 questions are also non-scored. It does not go towards the candidate's overall number. Only those original 15 questions apply to their overall score. So.
Thank you.
Are there any? Sorry, go ahead, Dr. Wong.
I don't know. I mean, I think I just wanted to bring attention to the board member because, I mean, I know I've been getting emails regarding licenses or new grad licenses. And in your presentations, when you talk to the students, we usually tell them what, like 10 to 12 weeks, which I know a lot of them get frustrated with. I think maybe we need to also inform everybody sort of the timeline, because I think a lot of the students, when they graduate, like it's mid-May, they graduate, and that's when they start the clock, and they're saying it's 10 weeks from that date. And I don't think a lot of them realize that it may take until mid or end of June for some of those official school transcripts to get to you. And then that's actually when the timeline starts. So I think a lot of them have 6 weeks have already passed, and they're expecting their licenses by middle of July, but the official transcripts, either from NBEO or from the schools, they just don't arrive as quickly as they think.
Yeah, they don't. A lot of the times we will get transcripts a good 3 weeks after graduation. And as much as we might want to process that application, we don't have what we need. And sometimes schools don't do electronically. All we get is paper. So it takes time.
So is there anything that the students should do to make that process go faster?
Unfortunately not. At that point, it's just patience. I mean, once you've passed your NVEO and you know that your transcripts have been sent, it's just patience from that point.
So I think that's one of the things that if anybody else is getting emails from people saying, Ma, it's been almost 3 months, that we do have to make them aware that there's a strong possibility that their transcripts may not have arrived at the board until mid to end June, and then that's when the timeline starts. So now it's only end of August.
And
Can't the students pressure their schools to send out the transcripts faster?
What happens normally when they do that is we'll get 3 copies of the transcripts at the same time. Which is always funny because I'll upload it and then realize it's already there twice. So they can, but what normally happens is we'll get 2 copies in the mail, 1 via email, and it doesn't necessarily help the process move any faster.
Sure.
And just to note, I did not mention this during the memo part, but we received 147 applications this year, which is far more than we anticipated.
Wait, don't transpose your numbers. 174.
Yes, thank you. Which is way more than we anticipated. So we're working to adjust for that number, but it does take us a long time to get through those.
And I know that we've talked in the past about having more people work on licensing. Shara, is that a possibility in the future? Can we hire someone, or?
It was good and encouraging to hear our budget report earlier today. I do work very closely with Bikram to the last, $100th of whether or not I can squeeze out another position. So we are trying to be thoughtful about how we can best use our budget to increase the capacity that we have in licensing. We do have an AGPA resource and an associate government program analyst resource and a management services technician resource who help in some of the initial processing of this. It also does take, training and understanding of the process and really comfort making sure that we're not erroneously licensing someone. We need to make sure that folks are proficient in the process and can move through and license without hiccups. So we're training up those resources to get ourselves to the place where we have more approvers. But that training, as Natalia mentioned, does take time. She's been working on some video training modules so that she doesn't have to take her time of processing in order to get folks up to speed in order to process alongside of her. So we are doing our best to give as much training as possible to the other folks within the licensing unit and to help them to increase their proficiency and then look to increase their production value or the production as well.
Great, thank you.
This is Joe Pruitt. I have another question. I was just curious, so is the processing a straight first come, first serve, or are there situations or instances where a particular application may get expedited in the processing?
Of course, most of the time it is first come, first serve, with two exceptions. Anybody with active duty or honorable discharge from the military is expedited, as well as those of who are asylum seekers also have expedited applications. Other than that, it's first come, first serve.
And I think folks have to realize too that, because we have the 6-month cycle on examinations, we encourage folks to get out there and start to take their California law and regulations exam, at the winter before they anticipate graduating, giving them that extra chance to pass the exam if there is an issue. So if you open your, your application in December, you're at the top of the list. May you not be quite as diligent in getting your fingerprints done or making sure that your NBO scores, that there aren't any discrepancies in that. There's no way for us to make sure that doesn't happen. So I really do think that it's important folks understand the queue, that it is first in, first out, except for those two exceptions. And that, when we get folks into the re-review queue, I think that folks have to understand that we don't have an opportunity. What I would love, right? If I could snap my fingers and have technology help Nat, Breeze would be able to run a report to tell me, a checklist of who's got what. So just let us know who's got, all of their items in, and then Nat can go in and license those folks, review the documents and then license those folks. Let us know who's only got, one thing in, and we can send them a deficiency notice. But unfortunately, we don't have that ability. And so it is very much not going in and, okay, so even in the re-review queue, all right, it looks as though I've gotten this, these transcripts have come in, or I've finally gotten, background checked from this person. It is a necessity to, she's processing 174 apps. To make sure that the new information is correct, to make sure that the information that was previously entered is correct. It's not a quick process to do a re-review either. It's not the same as an initial review, but it still does take a lot of human resource time in order to have that occur.
Can I ask yet another question? Is there a way for the applicants to review their Breeze file but by themselves so that they could actually, instead of bugging Natalia and calling her or emailing her, can they go in and look and see which parts of their application are incomplete? Or is
So
that something that you can do?
They can look on their Breeze file and see that it's pending. Unfortunately, there's no way to see what's missing until I review it, because I have to manually put, there is a way we mark deficiencies in the application, and it is viewable on an applicant's Breeze account. But I have to manually input, this is what you're missing your photo, you're missing your live scan, and then they can look at it. So if they haven't gotten the email yet, or it might have gotten lost somewhere, and they're thinking well, it's been 12 weeks, you can always check your Breeze account and look at that pending application, open it, and see if I've added something there.
Great. Okay, thank you.
Oh, I have a question just to kind of try to get more clarification. So is the problem that, is it more of like a computer programming problem in terms of being able to have Breeze, spit out that information that could do those things that you said that can kind of generate, these items are missing or, these people have, everything checked off?
Breeze is a wonderful program, but it's limited. This is very limited, especially since we have to upload those transcripts. We have to make sure that most of the time they can attach a photo, but most of them don't. We have to upload that. We have to upload NBEO scores. We have been wanting for a long time to see if we can get an interaction between NBEO's database to input into ours to make it a little bit faster. But unfortunately, Breeze is limited. It can't always tell what's missing. Unfortunately, it needs a lot of hands-on human interaction.
Okay. And I know it's not related, but for example, I just did like a DMV Real ID and I was able to upload all these documents myself to DMV website, but it sounds like Breeze doesn't quite have that capability yet.
Unfortunately not.
Okay, thank you.
Hey, Natalia, it's Glenn Kawaguchi. So one of the things that we're always confronted by is things that we want to be able to have from Breeze and that we are going to have to wait for. When we look at your training for soon-to-be graduates, a couple of suggestions I would have would be to add a best practices information. So, for example, Shara talked about when is the best time to take the CLRE, and why is it that you should take it at that time if you feel like there's any risk that you might have to retake it, and here's why. Here's your responsibilities in ensuring that your application is complete. Here are some watchouts for you, and here are the realities if you submit something incorrectly. So they have a clear understanding of what their responsibilities are, and they understand the watchouts for themselves. Because one of the things I know about students is when you highlight certain things for them, they're going to tend to remember it. So if there's certain key items that you want them to for sure execute on perfectly, you need to really have that highlighted on the slide so they have a clear understanding that, oh, so I should be taking the law exam in the winter. That's the best practice. I need to ensure that I do that. We can't rely on word of mouth from past graduates, things like that, or from staff at the schools. We really kind of need to make sure that they're understanding what their best practices are so they can execute flawlessly to make your job easier so you're not having to follow up with some that are not doing things in an orderly fashion.
I completely agree. And this presentation is actually one very similar that I present to our California graduates. Dr. Wong can attest to this. I spoke with Berkeley and I've tried very hard to tell them, please take your law exam early. Here are the things you're going to need to submit your application. And I actually had an increase this year of people who had more complete applications than last year. So that is working. I do eventually want to record myself doing this presentation and posting in our website. So maybe our out-of-state applicants have the opportunity to look at it. But for our California schools, I have definitely been trying to do that so they know what exactly to expect.
Yeah.
Well, that's my point is that you added extra comments about best practices, but they weren't necessarily on the slides. And so as you look forward to possibly a more automated process, be thinking about what they not only hear, but also maybe what they see to ensure that the training for them is complete.
Understood. I will make the appropriate adjustments then.
Yeah, Natalia definitely updated the presentation this past year, now that she's in charge of the licensing process, and it was much clearer than what we've given them in the past. So thank you.
Huge improvements from the past, that's for sure.
And then just to let our new members know, the CLRE or the law exam, it is available whenever any student wants to take it, but they're only allowed to take it once every 6 months. So when Natalia is talking about telling the students to take it in December or in the winter, it's so that if they fail it, they can then again take it again before they graduate. So the students could take it in their second year if they wanted to, but they usually traditionally take it somewhere in the fall or winter or spring if they're late of their fourth year.
A follow-up question I have related to that point is if we are communicating well with the soon-to-be graduating students and they start their application process earlier to be able to take the CLRE earlier, what's that going to do to our numbers as far as what it appears as our online processing time? Is that going to artificially increase that number?
No, so we consider our processing time not from when they submit part one or the exam request. We start that time when they submit part two, when we can collect that information on their NBE scores, when we can collect that transcript. We don't start it from when the exam application process starts because they could start that and then wait a year to take it. It's completely up to them. And the exam request is automatic. Once they pay that, it just approves them to take the exam. There's no processing time in that. So we start that processing time when they submit part two. If there were no further questions on the initial license process, I will continue with our review of the renewal process.
All right, so I'm just pointing out time also. So I'm going to give you a few more minutes, Natalia, because I still know that Shara has to give us her EO report, and I'm trying to be aware of the fact that board members might need lunch somewhere around 1.
Yes, I
think so too, Dr. Wong. So actually, I think, Natalia, I think that we've had good discussion on this, and that, in fact, it might be great to come back and do this renewal process as a separate presentation, because I think that once we also get into the more kind of difficult reinstatements and that sort of thing, there are a lot of questions, and there's a lot of hand-holding with applicants or with licensees in order to help them understand the process. And so I think it's going to generate a lot of questions. So Nat, unless, if you're okay with that, I think, and if President Wong, you're okay with that, I think we'll bring the rest of this presentation back to another meeting so that we can give it its due time to allow you all to question and break down the concepts.
If it's okay with Natalia, I think that's a great idea. Although thank you for the presentation, because I know that the whole licensing process seems like a mystery to a lot of our
yeah, and the original intention of this presentation was specifically to do the raising statement restoration, but also add all these stuff because I know board members had asked for that in the past, considering a last public comment. But if the idea is to postpone that, I'm fine with it.
Thanks.
I think it's interest of time.
Yeah.
Okay. All right, so then we'll next move to, thank you so much, Natalia. We'll next move to 7C, legislative and regulatory update. Want to make sure that I see that Mark Johnson is already promoted to panelist. For our new board members, just to know, Mark is a key part of this team and has really held 2 positions over the last year and a half. As you know, we've been very happy to welcome Jackie French, who was our administrative analyst and came on about the same time as Dr. Pruitt's appointment. Jackie is taking up, we've got her real busy on those requests for personal action, those HR requests, but she will be stepping in to help Mark, who's been holding down the meeting material preparation, working with analysts to get their reports together, giving you all the updates on, when we'll be meeting and how all of that will work. So I want to make sure that I give kudos to Mark too, who's really been holding down not just his policy desk, right, which is what he's going to talk to us about now, but also so much of the background to getting these meetings to where they should be for all of you.
Okay, I'll jump in. Thank you, Shar, for those kind words. Yes, I'm very excited to have Jackie on board and being able to be an additional resource for these meetings. So Dr. Wong, I guess if it's okay with you all and Shar, I'm going to move to the legislative and regulatory update. And I know in interest of time, because you wanted us to take a lunch in a short time here. I think I'd like to just hit a couple of key points on the legislative portion. Just a couple of key things to just look at. August 27th is the last day, which is today, for fiscal committees to meet and report bills to the full legislature. All of our bills are out of committee and being considered on the Senate or Assembly floors, all of the bills that we have taken support positions on. And the last day for the governor to sign and veto bills is October 10th. So we will find out by then if our bills have been signed into law or vetoed or anything like that. AB 407 is the optometry scope of practice bill. This is the California Optometric Association sponsored bill. It may be logical to ask COA to speak, if that's okay, Dr. Wong, if they can give us an update on it. I know they've been working behind the scenes on some things. If
I think that would
Christine
be
Schultz
great.
is available.
I think that would be a great idea. Thank you.
Great, I think, and then also too, kind of as we're looking at this list, once we open public comment and allow COA to speak, they're also, intimately working on the negotiations on Assembly Bill 691 and Senate Bill 509. So I think, Mark, as you were saying, in interest of time, let's skip to 1534, our sunset bill. And then we can open up public comment, Dr. Wong, if you're agreeable, and get some updates from the public, more than likely also from COA with the negotiations that they've had on those other bills.
Perfect. Thank you.
Okay, so on that, we'll jump to AB 1534, which is the board's sunset bill. As you know, that this bill has been undergone quite a few changes from our original submitted changes. And I'm actually going to ask Shara to just update us on some of the things, because there's been a lot of changes between the legislature and between our board, and Shara's been really taking the lead on that. So Shara, is there any update you can provide us?
Yeah, certainly. I think it's most important that our board members know that we've been working very closely with legislative staff in both the Senate and the Assembly. I've had some really great stakeholder meetings with some of our larger optician companies. So working closely with National Vision, America's Best, Luxottica, Lens Crafters, and having conversations with them to make sure that the intent of the board has remained in language. And I do, the legislature, things can always change at the last minute, but we've had really good and I think very transparent discussions. And a lot of what the board intended, what a lot of the board sent to the legislature within our draft language actually has remained. And we've worked very hard. And I think that the stakeholders also have worked hard to understand the intent. And then for us to look at, okay, so in practicality, how does this work? I think that this has been a good legislative session for us. And I want to give kudos to our stakeholders who I think have been honest and open in discussing that. We expect that we'll see another version in print by mid to end next week. And so we can certainly, we'll shoot folks out that language and field any questions if there are individually. And then, of course, if the president or chair, Dr. Turetsky of our Ledge and Reg committee, see a need for us to convene, then we will, of course, accommodate that. But I think that this has been a good legislative session for us. And again, I think the negotiations have been very transparent and very much in keeping with the spirit of what the board intends for both optometry and opticianry in the future. Dr. Turetsky? I think I saw your hand. Yes, now we can.
Hey, I have internet. One of the fires ended up frying the cables to my distributor, so I have internet back again. Question on 1534. Section 10, H1. And it's discussing a $50,000 fine for a violation, and it's mentioning fines per investigation. So here's my question: if Dave's Optical has 15 offices, and I have been violating some part of the Optometry Practice Act at all 15 of my offices, and there's an investigation, and I am fined $50,000. Am I fined $50,000 for the investigation for all 15 offices, or am I fined $50,000 15 times? That's my question on that one. Can you clarify that?
So that is a portion of the bill that we are having discussions about. I think that, again, we've had very open conversations with our stakeholders, and they understand the need to keep scofflaws from adopting, business practices essentially that are outside of the law. And so I think that there is an understanding that grouping things in investigation really limits the enforcement authority of the board. So I hope to have some clarification on that within the next draft language, the next amendments that are made public next week.
Okay, thank you.
Of course. Any other questions that I can field on 1534? Okay, and so I wanted to just, I'll, Mark, if you don't mind, a part of also too of our time savings is that, again, we have had some really great negotiations. I think this has been a great legislative session for us in 1534, and then also in the bills that have been run by COA. And so several of our regulatory packages are possibly preempted by the language that will be adopted by the legislature in the next coming weeks. But again, good discussions with stakeholders, abilities to move language into statute that mirrors the technical assistance given from the board, mirrors the intent and language of those regulatory packages the board has passed, so that we can get ourselves to practice a little faster than the rulemaking timeline has allowed. So we will certainly update you on those reg packages when we come back to our next meeting, but know that we're hoping that we'll see some movement on some of those issues with the passage of these bills in the legislative session. And if there are no other questions, then I think
I have kind of a more broad question.
Yes.
So since our last board meeting, what's your opinion on changes that have been made to the bill? And where are we at with that? Like, it's hard to see substance if there are already specific of substance changes versus what you're talking about, which is it's just cleanup. So were there any major changes to the bill since we last spoke?
Mark, will you remind us the date of amendments for the bill that's currently in print? So I think that if folks do take a look at the version that is currently in print, it will give you a really good understanding of the way in which the way in which the legislative proposal, I think, will come out next week. I think that we are making some tweaks here and there, sort of the things like, Dr. Turetsky just mentioned about investigation versus administrative action. But I think that very much what the committee made public in that last amendment, with those last amendments, is still very true to what we'll see in the next public draft next week. Okay, I think with that, Madam President, if you're interested, we could open up public comment and see if there are any folks who would like to give us updates on the other bills on our watch list.
That sounds great. Madam Moderator, if you could open up public comment.
Thank you, Madam President. I have opened up the Q&A panel. If any member of the public would like to make a comment, please type, "I would like to make a comment," using the field in the lower right-hand corner of the screen, and send it to all panelists. We are displaying instructions for your reference. If you do not see the Q&A panel, click on the box or question mark within a box at the bottom of your screen in the lower right-hand corner. And we do have some members of the public that would like to make a comment. Please remember there's a 2-minute time limit. I'll give you a 10-second warning. And our first person is James Jack. James, I'll click on you so that you're able to unmute yourself. All right. James, you're unmuted.
Great, thank you, Madam President and board members. My name is James Jack, and I'm speaking today on behalf of National Vision, which operates nearly 150 optical retail locations in California. And I wanted to speak to Dr. Kawaguchi's question as well. At this board's May meeting, you had authorized staff to request the inclusion of optical retail statutory changes into the Sunset Bill. These changes have been extensively deliberated by this board, several of its committees, and allowed time for all the stakeholders to understand the implications and to provide feedback. We're very concerned that since then, the board's effort has somehow expanded to include some pretty profound new changes to optometry law, including new limitations on business arrangements between optometrists and physicians, surgeons, RDOs, and health plans. And as a result, the Sunset Bill now contains some pretty broad and hastily drafted language. And as Ms. Murphy stated, we have had some good staff discussions, but the concern here is that the implications of this broad new language have not been publicly examined or debated by this board or any of its committees. I mean, we literally received brand new Sunset Bill amendments at 9:30 p.m. last night that we've never before read, and all of this is happening with just 2 weeks left in the legislative session. And you know, whenever you're crafting law in haste, you lose the ability for public vetting and to understand how they're impacting consumer protection, competition, or improved access to care in California. And our concern is that sunshine laws apply to state boards in California to guard against this very situation. So in closing, you know, given the gravity of these proposed new statutes, we would respectfully request, just at a minimum, this board's deliberation and a public stakeholder process to review the implications here instead of pushing broad new laws through under the cover of darkness in the final few hours of the legislative session. Thank you.
All right, our next request for public comment is from Christine Schultz. Christine, I'll let you know when you have permission to unmute yourself. And Christine, you should be able to unmute yourself.
Madam Moderator, she is updating us on 2 of the bills. Let's take the 2-minute time limit off of her since this is per board request. Thanks.
All right. And Christine, you should be able to unmute yourself. This is the moderator, and Christine, you should see a microphone at the bottom of your screen. If you click it, it turns green, and that means you're unmuted. All right, maybe while we wait for Christine to work on her microphone, we can take a public comment from Vivian, who has her hand raised. And Vivian, you should be able to unmute yourself. Oh, Christine has unmuted herself. Christine?
Hi, this is Christine Schultz. Sorry, I had the problem with the mute button. I just wanted to give everyone an update on our legislation. We have, of course, our scope of practice bill. I can go over it briefly. I don't know. I mean, the biggest change is that it eliminates the list of drugs, eliminates the list of conditions that optometrists can treat, and instead allows for treatment of conditions of the anterior segment. I think it There are a lot of cleanup provisions in here. It takes away some of the limitations on treatment of these conditions. It allows for optometry to grow. I think that's probably the most important thing. And change as new technology, new drugs come out. It deals with the presbyopia problem, the myopia problem, the problem with being able to prescribe Upneeq. It allows IPL, which is intense pulse light treatment explicitly, which was unclear in the law before. And there's some other provisions that we're still continuing to talk about. There are going to be some amendments to the bill to address some of the concerns that were raised, eliminating the biologicals prohibition. Also deals with the co-management under 18, to make sure that that's still allowed. It would be done as long as the primary care physician agrees to the arrangement. There's several different really positive changes in here that we're quite pleased about. And so we should be finished up in the next couple of days to make sure the language gets into council in time on this issue. So I'm happy to answer any questions about scope of practice. Great. Also 691, obviously, our legislation to allow optometrists to continue to administer COVID vaccine and to allow for testing being so important right now for many healthcare providers. That bill's moving through as well. And also our other bill, SB 509, that legislation by Wilk to allow to create a provisional license, a temporary provisional license that allows people to practice if they close the MBEO again, basically resulting from COVID. So under supervision of another optometrist, all those bills look like they'll pass and move forward. Any questions? Great. And I just wanted to, mention, in my public comment, I was going to mention really just thanks so much to your executive officer and all your team on the board. Staff has been so helpful in developing these sunset review rules and regulations. We are in strong support of the board's actions. Very excited about some of the enforcement provisions, including the ones that James Jacks mentioned before. We think they're very important changes to make sure that enforcement of the board can continue to enforce the law and make sure that all of the different types of businesses that are out there, all of them follow the laws that were negotiated back in 684 and making sure that the public is protected from different types of business arrangements. So I want to thank you so much and can answer any questions again. Yep.
It looks like Dr. Turetsky has his hand raised.
I do. And Christine, I'm not sure if something you can answer, maybe Shara. I actually had an optometrist shoot me an email wondering if she is able to administer home COVID tests, not something that's going to be submitted to any entity or anything, but a patient that she might feel questionable about examining. She wanted to know if it's legal for her to do a home type COVID test in the office just to see if she feels comfortable seeing the patient.
Is that a question to me?
You or Shara or whoever wants to jump in, because I don't know the answer on that one.
I don't know the answer either.
Shara?
I want to make sure that we're comfortable, that we're not providing legal advice to licensees. I think that that's an excellent question, and it's certainly something that we can discuss with COA as they're continuing their run of this bill. Educational efforts in the future. Just making sure that we're not giving legal advice to individual licensees, but I think we can certainly talk about whether or not there's something within this bill that might address that.
Okay, thanks.
I have a question on the sunset bill. Regarding the new draft, included in the new draft it does not sound to me like it's a new topic that was not addressed in earlier drafts or in our testimony before the legislature. Is that right? It's not coming in out of the blue. It's stuff you've been working on or we've been discussing.
That's correct, Vice President Mordomi. Definitely. So I think that National Vision is speaking specifically to changes to Business and Professions Code 655. That text was a part of the materials for the 5/21/21 board meeting. They were available to public as well as to the board. There was discussion of the need to address that particular language in particular, and there wasn't a request by a board member. And again, yes, this was very much a topic of discussion during our sunset review hearing, and one that Chair Lowe really did take an interest in how he might help us to improve the laws to really make clearer our authority. So I understand the concerns of industry, but I want to make sure that folks are aware that that language was part of our 525 packet that was approved by the board of what would be sent to the legislature as our sunset responses and the cleanup that we were looking for. And then, of course, was discussed extensively during our sunset review hearing with Chairman Lowe, as well as Senator Roth, Dr. Pan, and several other members of the Joint Sunset Review Committee.
So is there anything else that we need to talk about in the EO's report for section 7, or should we move to section 8?
This is the moderator. We had one more public comment.
Sorry. Yes.
That's okay. All right, so we have a request for public comment from Vivian. And Vivian, you should be able to unmute yourself. All right, Vivian, you're unmuted.
Oh, hi. Sorry, I wasn't expecting this. My name is Vivian. I am a new grad. And regarding licensing, I just wanted to give a new grad's perspective on this. We are all a little bit desperate, so that's why we're here, or that I'm here. First off, I wanted to say that we do know that it will take about 10 weeks to get our licenses, and that 10 weeks does not start until our transcripts are sent. However, for many of us, it's surpassed that, and there's not a way we can track whether our app has even been viewed. In Breeze, there only says the app is pending. When it passes this 12-week mark, and for a couple of us, I'll say it's been over 12 weeks, we're wondering if the app was lost or if we should resubmit, or if there's anything that we can do to help the process along. I did attend Natalia's presentation at our school, and I thought it was really helpful. And every time I interact with the office, everyone has been very polite, and they try to be as helpful as they can. But in practice, there's a huge communication error among the office and Breeze and PSI. Each organization kind of thinks the problem is with the other. And personally, I wasn't able to track my PSA packet and CLRE instructions. I was bounced between these 3 organizations for several weeks before I finally just asked PSI to schedule an exam for me, promising that I would pay for another one and take another one if it indeed did not connect to my profile with Breeze. And I know that I was definitely not the only one to experience this. And sorry, I know there's time limits, but if our licenses are going to take several months, we need to know, because our future employers were expecting us to start work, and they view us as being unprofessional and untimely. despite their flexibility and understanding of our situations. And
And this is the moderator. That's the end of our request for public comment. Would you like me to close the Q&A panel?
Yes, please. And I believe
Okay.
Dr. Turetsky has his hand raised again.
I do. Quick question for, I believe, Mark. Are you still there, Mark?
Hello, Dr. Turetsky.
Oh, Mark. Um, one of the bills that's mentioned here is AB 458 in-home care. What's the time frame after enactment that licensees have to comply with the provisions of the statute?
So the regulation is silent on that, and I actually had anticipated that this might be brought up, and I had actually checked with our legal counsel, and she advised that the answer basically kind of depends upon when the regulations become effective by. This package is currently we're still prepping it for submission to DCA. So whenever this goes through the public comment period and becomes effective in law, which probably be sometime in 22, is when those regs would be. Um, uh, that's when that would be in place. So.
So once public comment's over and the bill takes effect, how long do licensees have to comply with the provisions? Is it immediate? Is there a 30-day grace period? Anything like that?
I do not see anything in the regulation about the grace period. It would become effective when the regulation becomes effective. So if the regulation was effective, say October 1st of 2022, that's when it would be effective. That's when the requirement would be in place.
Okay. And will there be notice on the board's website or to licensees about the public comment period?
Absolutely.
That's my question. Thank you.
Okay, are there any other comments about items in agenda item number 7 from board members? Right, so it's now 1:22. We do have a hard start at 2 o'clock, but there is one more item on the agenda, and that is the PEC update, I believe. Do board members want to push through and talk about the update on the continuing education regulations, or do we want to do it after closed session? Should we try to go forward for like another 5 more minutes so we can get an update on the update for the continuing education regulations? Is everyone okay with that?
I approve.
Okay. Well, I got Dr. Turetsky's yes. So unless you guys all say no, we're gonna go on and push through and finish up with item number 8. So then we can then break for lunch and then just come back for a closed session only.
Great, and I'll let Mark go ahead and start presentation on this item. And actually, want to make sure that Natalia also, so always a group effort, right? These come from discussions within the Practice and Education Committee. Of course, Natalia is now our staff liaison to that committee, and she and Mark have worked together on these changes to the regulatory package that was approved by the board previously. So with that, I'll let Mark and Natalia go for it.
Okay, I'll just give a quick update. Natalia has been working directly with the PEC at the last meeting, so if it's okay, I'd like to have her just go over the changes. I'll just note that the 1536 CE package is basically ready to be sent out to DCA for review, and then it will, once they approve it, it'll be out for public comment. So these changes will be integrated into that package and then sent to DCA. Okay, Natalia's having a hard time with the material, finding the materials. So let me, okay.
So to give a little background while Natalia is getting prepped, Each time that we hold a practice and education committee meeting, there are comments that are almost always said. Which category of education do they want for this? And for online platform sessions, are they turning their cameras on? And so in order to keep from having an underground regulation, we're asking to include on the form the specific educational categories, and then an opportunity for providers to tell us what they will use as participation verification on an online platform. So if there will be the use of cameras, if there will be the use of in-content exams, if there will be a log or report of log on and log off times, if there would be a testing post the session. So this gives us an opportunity to understand how within the online platform this provider will ensure that folks don't basically log in and then walk away and do the dishes. So we're hoping that these categories, that these specific ways in which you can validate participation will help secure the integrity of those really beneficial online continuing education courses that we know licensees have been availing of themselves of the last year and a half. Nat, do you want to go through the individual text?
Yes, I will. So as we discussed, we wanted to add categories. Specifically, several categories were not listed within statute already. So for, where is it? Section 3 of 1536, we added the 3 highlighted sections for continuing education courses under the following categories may be accepted as continuing education course to be approved by the board, which includes patient care management, systemic related disease, and categories as required by 3050E of Business and Professions Code, which I believe, if I'm remembering correctly, Mark can correct me, is the elder abuse and child abuse. Let's continue. And so if we look at the form, you can see how
Just
all.
one second, Nat, we're a little bit ahead of our slides. So I want to make sure that folks, public and the members see that this is, oh, if you could just go back one more, sorry about that, Tom. So these are the 3 areas that Natalia was just describing, the streamlining to patient care, systemic related disease, and then any categories as required by section 3059. And so if Tom, if we'll flip to that next slide, this will give you the listing of those categories. And then Natalia, if you'll proceed.
Thank you, Shara, for adding that. If we look at the new form, or rather the modified form that the board approved back in 2020, we can have each course listed out. And this was to encourage, because the current problem with CE courses is that a lot of CE course applicants don't know which categories we offer. Or so we listed them out so they could just check off which they feel is appropriate. And PEC may look at it and go, well, they listed it for clinical optometry, but it may be more ocular disease. But this should help us better gauge which categories most of our course approvals are for. Because of that change with the list, we removed a section at the bottom that had them write out the category. And in addition to that, we also changed the, if they are doing a live course, to please check which apply for your live courses. So they now check off if they do participation auditing or in-content quizzes, video on required time logs, etc. So they have to check which ones they apply for online live courses. And there was a minor change in wording for additional course instructors that was non-consequential. So. Are there any questions? I believe that was everything.
Dr. Grace, I have a question.
Okay.
Go
Go ahead,
ahead.
sorry.
Yeah.
There are some that COPE has separate. I think that for us, let me go back up to the list. COPE has ethics and practice in optometry, has child abuse and elder abuse within that category. Because our statute specifically mentioned those in other places, we separated that out. So they are different, but ones that we did not have before that COPE had, we added those in as well to kind of match that.
Cope's list is is longer than our list, correct?
Yes. When I was looking at COPE's categories, they had like overall categories and then subcategories within that. So when I was looking to add categories for our own, I just looked at the large categories rather than the subcategories that COPE has.
So follow-on question. So can we put child abuse detection and elder abuse detection in a subcategory rather than in a category of its own?
That's not something we've done before. And I think Shara looks like she wants to make a comment.
Yeah, certainly. Just this was really a strategic move. We've had the mandate from the legislature on our books for several years that we should be encouraging providers to develop course content around elder abuse and child abuse detection. And in calling these two out, we take an opportunity to educate the provider network, the provider sphere, that these are courses about which content could also be created that would be approved by the board. So the intent really here is to provide some communication to the provider space that these are topics that California's legislature has deemed as important in providing continuing education to optometrists.
Was there another way to do this besides listing them as separate topics? I'm just curious, if we're trying to align with COPE topics, this doesn't really align with the COPE listings classification.
Certainly. So what we've tried to do is really make it clear for folks what's in statute and what's in reg. So this is our first time that we've ever had a clear list for the providerverse. I'm going to start using that providerverse that says quite easily, like, this is what California has deemed important for continuing education. So what we've basically just done is taken the statute and put that here as a form of education. So we're really trying to align what we say in statute, in reg, and on the form in order to help better educate the providerverse on what sort of content California has deemed appropriate and what we can as a board accept.
Maybe in light of this discussion, maybe Natalia could work with the PEC and PEC could review the subjects and compare them to the COPE categories one more time before we submit this, or do we need to submit this right away?
That is, of course, the pleasure of the board. With this, if we were to have approval today, we would be able to move this legislative package forward. Our covering two desks has along with these additional discussions, delayed us a little bit. So we would like to get that moving as staff, but of course we want the regulatory package to reflect the will of the committees, the board members individually, and the board as a whole.
I mean, I think looking at these categories, it's great because it's always been an issue having been on the PEC forever. This definitely makes it clear. I think Dr. Turetsky has his hand raised also, so I'll stop.
I do, thank you. If an elder abuse or child abuse, elder abuse presentation is given by a state recognized or nationally recognized organization, they're not somebody that's related to optometry, but one that's related to like nursing homes or something on that order. They're not going to apply for board approval for their content. Is there a way that the board can say if this is presented by such an organization that it is accepted? California Association of Healthcare Facilities, something like that, though their presentations are accepted, or does it have to be something that goes through the board for approval?
So any course that isn't either adopted by COPE or presented by one of our universities needs to go through the board for approval. I think though that this is our way of saying those national hospital, organizations or national organizations, your content is something we do want to provide to optometrists. So maybe take a moment to think about how this might particularly apply to the practice of optometry, or, and then present to the board a course that does speak directly to elder abuse and has some content that directly relates to the optometry profession. I think that it would be interesting. That's certainly something that they could submit, and certainly something that the PEC members could decide if it had benefit and adhere to the law of what we think is important to ask optometrists to continue to learn about.
To build off of what Shara said, one of our biggest CE course applicants is Kaiser, and it may be that Kaiser offers some of these related courses to child abuse and elder abuse already to their doctors, and Kaiser could submit those course approvals for that to be approved here and get CE credits for those. So it's definitely going to be applicable in certain places, especially for our course approval applicants who consistently already provide different courses.
So this is Glenn. My opinion is we've been going around and around, and to send it back to PEC and run the risk of this postponing even longer, I'm worried about that. There are certain changes that we passed as a board years ago. I agree with Dr. Garcia about the mismatch with COPE, but maybe it could just be solved if we have further discussion after we have closed session. I just don't want to push this back to another committee meeting and then we got to bring it back to the full board again. I think we need to try to push through this today at some point.
And I do want to make sure that folks understand that anything that is approved by COPE, if a course has COPE approval and that presenter is then also approved to give that material, then that is accepted within the CE calculation for our licensees. So if you were to take the other, particularly, right, we are not at a point yet where we have diversity, equity, and inclusion as a part of our CE categories, but that is something that COPE is addressing. And if COPE deems that that material is sufficient to give accreditation to the material and accreditation to the presenter, then of course a licensee who takes that course would be able to use those units toward their 50 hours of continuing education here to meet California standards.
Well, as a point of process, I'm confused about why we're even bringing this back with edits, because I think at a prior board meeting, we as a full board approved to move it forward as a legislative package. So is it because we're getting pushback in the legislature, or is it just additional things keep being proposed?
No, it really is that this regulatory package was approved by the board. It is in queue to be submitted to department, agency, and OAL, but we have not had staff bandwidth to do that. And so in the transition of bringing in Natalia as board liaison, we were finally able to have some deep discussions and analyze the processes and what we continue to see as issues within PEC. And so because it has not moved to that, the package has not moved to that next step, we have an opportunity to clean up these things and then make sure that staff, as we've gotten more capacity, thanks Jackie, that this becomes the next thing on Mark's plate to move to agency, department, and OAL for approval.
Do we want to move this discussion after closed session? We have a hard start at 2 o'clock, and we should not be eating on camera when these people are appearing before us and hearing us. So,
All right, so I was trying to adjourn us before closed session, but it sounds like there's definitely a little bit more to talk about. So can we come back after closed sessions, Ashara? And
we have an open session first with the respondents, petitioners. So,
oh, okay.
Then there's a closed session. So,
all right. So why
I
don't we
apologize. Yes.
Why don't we adjourn first? Come back at 2 o'clock. Sorry, guys, you get 20 minutes for lunch, and then we'll talk about this after closed session.
Or after public hearings before you adjourn to closed session.
Before adjourn to closed session. Okay. That sounds great.
Excellent.
Thank you.
Thank you, everyone.
All right, see you guys at 2 o'clock.